All right. Welcome back, commissioners. Welcome back, Chair Harrington from Salem, and back to you, Vice Chair Rogers.
A little bit of flavor for Catherine's daily routine. I had to run up and do an interview with Coin 6 on the housing project, Wood Spring we just did. And so I was eating and trying not to look like Bosco the Clown, and nobody knows that anymore. Do you guys know who Bosco? Remember that character, cartoon character that always goes
Bozo?
Bosco. He had that eating hamburgers. I know Jerry's saying it's an old thing. Okay.
No, Pam was in the third grade then, so.
Ouch, ouch.
Not hardly.
All right.
Well,
All of you.
Yeah, we digress.
Well, good afternoon, Chair Harrington, Board of County Commissioners. For the record, my name is Mira Samantel. I'm the Director of Health and Human Services. Really excited to be here this afternoon with our fantastic team to provide a financial as well as an architectural design update on our Center for Addiction Treatment and Triage, otherwise known as CAT. I will go ahead and turn it over to Kristen Burke, who is the project manager for CAT, as well as Nick Cohn, who is our Behavioral Health Division Manager.
Good afternoon, Chair Harrington, Commissioners. My name is Nick Cohn. For the record, I'm the Behavioral Health Division Manager here with the county. And as Mira mentioned, we're going to be providing an update today on our Center for Addictions Triage and Treatment. Next slide, please. Oh, you need to give yourself introductions too. Sorry.
and hello, commissioners. My name is Kristen Burke. I'm a supervisor within the Behavioral Health Division and lead on the CAT project.
So today's presentation is really going to focus on two areas of updates. One, a financial update, and then second, an update on our facility design work that we've been undergoing on the project. Next slide. So just as some level setting, to remind everybody, the CAT concept is really a project to bring a comprehensive substance disorder treatment array of services to our community, really with the goal of bringing this to the community so that our community members can access these supports when they need them in their home county near their family. We've mentioned before that we've been under-resourced with these services for years, and we're really hoping to bring some additional infrastructure to our county. As we've mentioned, we're really taking a split campus approach with our CAT services and supports. And so we're going to have two buildings, our intensive services building, which is going to be located on Evergreen Parkway, and then our community services building at Elam Young Parkway. Our intensive services building is really focusing on our residentially based services. We're going to be adding 86 beds of additional capacity to our community, and all of those services will be operated by CODA Inc. Our community services building is really, they're going to be our outpatient supports. And so this is an integrated and coordinated service model that we're going to be developing to meet the needs of our community. So some of the significant milestones that we want to update everybody on is that we are having this split campus approach, as we have mentioned before, and we currently have both buildings both selected and secured. We've actually fully purchased the building at Elam Young Parkway, and we're working actively with our architect on designing both of these buildings. As I mentioned, CODA will be operating all of the services out of the intensive services building. They are our selected provider, and they're actively working with us on both architectural design of the space, but also the design of the clinical programming as well. Our architectural firm that has been selected is Holst, and we've been working actively with them hand in hand to be designing this project and bringing it to completion. One of the exciting pieces of news that we've had in the recent months is that we've selected our outpatient services provider, Solutions Group Northwest, that will be operating out of the community services building. They're a culturally specific, bilingual, Spanish-speaking provider that has been doing a fantastic job engaging our Latinx community. They are very excited to be a part of this project and to expand their services in our community. Next slide, please. So the financial update that we wanted to catch everybody up on is that it's just where we're at related to raising the funds necessary to complete the capital build. So when we originally estimated the project costs, in our feasibility study in May of 2021, we were anticipating that this project would cost between $62 and $72 million to complete. At that time, we were really hoping to purchase a piece of land and build from the ground up. And we're not able to identify a parcel of land that met our specifications and our needs for this project. At that time, we really changed our plans and to our current split campus model, and where we would purchase 2 buildings, we would remodel those buildings to meet the clinical needs of the supports that we were hoping to develop. At that time, we completed a fiscal analysis in line with some professional cost estimators, and we had a preliminary estimate of that design to be $41.5 million. In December of 2022, we went back to those same cost estimators following the schematic design of our project that we during the work that we got with our architect Holst, and had a revised estimate of $62 million, which was obviously a very different figure. We've been working with our architect over the last several months to be able to get costs down, really as we're working with them to ensure that we're not compromising either safety or clinical design when we're designing this project. And we're really operating off of a new target budget of $60 million today. This slide really details the funds that we've either raised or anticipate that we will be raising between now and the end of design. These are committed funds that are either in contract or opioid settlement funds that we've been told we will be receiving before construction is complete. Right now, we've raised about $51.2 million, leaving a gap of about $8.7 million to go. So as I mentioned, we have a gap of about $8.7 million, and this slide really lays out what our financial strategy is to close that gap. There's currently potential additional funds that are going to be available from healthcare organizations. We've received multiple grants from healthcare partners that we have. We'll continue to explore if additional opportunities are possible. We'll also be looking at the opportunity of a Measure 110 grant extension. That being said, we understand that the funds being available during the next round of contracts are not going to be the same amount as they were previously. So we're waiting to see exactly where the priorities will be as far as those next round of grants, but we aren't as confident as we once were that we'll be receiving the same level of funding as we did the first time around. We'll also be exploring grant possibilities through the state opioid settlements. 45% of the opioid settlement dollars that are coming into the state of Oregon are going directly to the state for distribution into the communities. And we're hoping that in May or June, that committee that is governing that process will have a grant opportunity process so that we'll be able to apply for those funds. Additional options that we have at the direction of the board are a federal earmark request or a state legislative request. In partnership with our GR team, a couple of weeks ago, we submitted a federal earmark request to Senator Wyden and Markley's teams, and we're really hoping to hear back about that soon. We're also going to be looking at additional opportunities through this long session right now, where we would have opportunities to either apply or be awarded funds toward this project. As a last resort, we've been working already with our finance department and our CFO, Greg Munn, on the possibility of financing the remaining balance that we have toward construction with future opioid settlement revenue. I had mentioned in the previous slide that we've either received to date or anticipate that we'll receive $8.7 million during the time of construction. And these funds are going to continue to be distributed to our county over a series of settlements for the next 16 years. And so we will have additional revenue coming in, and we would look at as a last resort potentially financing against that additional revenue to close the gap. And finally, an update on the funding toward our services. When we developed our fiscal analysis in 2022, we showed that the services, the operations of the program would be primarily funded through Medicaid and indigent funds to support the treatment costs. At this time, we're still feeling that all services are going to be fully funded outside of sobering and the peer drop-in program. We're also really confident that the maintenance costs of the 2 buildings will be funded through the lease agreements that the providers have. We're really hoping to continue to use those opioid settlement dollars for operational stability and to be able to offer the leases at a competitive and appealing rate to the providers that are going to be there so they can be financially successful and sustainable when they're operating the services of these programs. And finally, we've been working really closely with our finance department and Greg Munn to develop a 5-year strategy for program stability. We've completed a pro forma, really looking at both raising capital, but also those ongoing operational costs. And we're feeling really good at this point that we have a solid plan in place, not only to be able to launch the program, but to be able to sustain it going forward once we open the doors.
And I'll just add, when it comes to sobering and the peer drop-in center, those are services that are likely going to be Medicaid reimbursable over time through an 1115 waiver that's being submitted to the federal government. And so we believe that a lot of the sobering costs will be able to be covered under Medicaid. Not all of them, because not everybody is covered by Medicaid. And so we're looking at other resources such as future grants, opportunities through the Measure 110 dollars, and other opportunities that may be available through OHA to fill in the costs for those services.
What's the cost of those programs?
We're still working on getting that really fine-tuned because the cost of workforce is changing. It's going up as we're needing to be more competitive. But our provider, CODA, is working on developing staffing models and everything to determine that. We expect it'll be a little over $1 million annually for sobering services, possibly more than that, but around that area.
And the peer drop-in, what?
We have a peer drop-in center already in Washington County that is about $500,000 a year to operate. And so we expect it would be about that as well.
That Hawthorne?
No, that is the 4D O'Rourke Center in Hillsborough.
Okay. Sorry, go ahead.
That's quite all right. All right, now I got to talk about the fun stuff. I'd like to talk about some of the architectural design work that we've been doing and share some images that we've received from our architects. So as Nick mentioned, we have 2 buildings that we'll be operating out of. The Evergreen building, which will hold intensive services, and then the Elam Young building that will have our community-based services. So I'm going to talk about the Evergreen building first and share some images there. You might recall a while ago, I shared some images and mentioned that we were looking at 2 options for the Evergreen building. One was going up, doing a 2nd floor to the existing building. The other option was to go out and build basically an addition to the building that's connected, but basically separate. So we had both priced out, and it turned out that going up is significantly more expensive. And so we're going with the going out option, which actually clinically works better anyways, because it allows better separation of services across all the different programs that'll be located in that building. So this is our current rendering of what the Evergreen building should look like when we're done with this process. You might notice that previous images had the addition be a little narrower and taller. We actually, through some of the value engineering that we did to bring down some of the costs, we looked at moving it down to 2 stories, but a little wider. And so that actually worked out really well for the clinical programming as well. The intent is that the existing building will be used for sobering, detox services, and then all of the kind of core things like the kitchen and laundry and dining rooms. So that'll be the main building. The new addition will be our residential treatment program. We'll have 2 programs in there. The residence, the dorm area will be on the 2nd floor, and all of the clinical treatment services will be on the main floor, and those will be separated. The buildings will be separated with a courtyard in between. One of the nice things about this model is that we'll have a main entrance for sobering and detox, and really kind of the entry into the building, which is right off of the street. And then the residents who are living in the residential program will have a separate entrance to come and go, which will really help with the traffic and the flow of the people who are using the building. Here's just another view of the building. This is really looking at the residential program. One of the things we're working at is trying to tie the 2 buildings together so it's a little more of a cohesive look. So that's something that we're still working on, figuring out what can we do to the existing building to really make it align with the new building and look very cohesive, like I said. For those of you who have ever been in the 911 services, the WACA building prior to that program moving, this will look really familiar to you. The building actually has some great assets. It's got a lovely skylight that runs the entire corridor of the building, and then also wood ceilings and these really nice wood beams. And so that's something that we wanted to retain and utilize in this program because it's a very warm feeling. So our architects were able to keep those and really use other assets of the building and fit the programs in there quite nicely. So this is about the only part of the building that will look similar to where it is right now. The rest of the building is going to be pretty significantly modified. One of the things we really like about this model is the ability to have a courtyard that separates the two buildings. The courtyard actually will be two separate courtyards divided by the enclosed walkway between the two buildings. This is the courtyard that really is a garden space. It's really centered on bringing nature in and having a really warm space for the residents to utilize. It's being set up in a way that they can actually hold treatment groups out there and really provide a nice, safe place for people to recreate outside while they're in the residential program. The other courtyard, which I don't have a picture on right now, really is a much more active space and includes a basketball court and other activities that people can engage in when they're living in the residential program. Now I'd like to talk really quickly just about the Elam Young building and share some of the design ideas we have for that. Now, as a reminder, the Elam Young building is going to be multiple programs sharing the same space. So multiple organizations that are all in the same space. So we wanted to tie those together in a way that really created a central hub that people could come into and then access the different services. The one thing that we are holding out is the main entrance to the Hawthorne Walk-In Center. That will have a separate entrance from the exterior. And there's a variety of reasons for that, really clinically based in terms of helping to support the people who are coming and accessing that service. So there will be two entrances. If you've ever been to the Elam Young building, and I know you all will be coming here shortly, we'll be giving you a tour, you'll notice that the entrance to the building isn't very highlighted. It's sometimes hard to find where the front door is. So we're really working hard at elevating the front door and elevating the wayfinding around the building so that people will know where to go when they arrive to the site. So this is the building. What we're going to be doing is really creating a whole new entrance in the front of the building to make it very clear. And then on a smaller scale for Hawthorne as well. That's really the big exterior changes that we'll do. We'll also update the paint scheme, which is not picked yet, the color, but this is the architects like teal. So we'll probably not go with teal, but we will be painting it, but that's really the exterior changes. The interiors where you see a lot of the changes. This is the entry to Hawthorne, and we want to create a bit of a plaza areas that people can wait when they're waiting for rides. Family members can wait, that sort of thing. This is a rendering of the internal hub space. And so you can see, we're trying to bring in, again, those wood features, those warmer features, plants, really sort of that healing nature as much as possible into this space. So this is the hub, which means you'd go down one hall and you would reach Washington County Behavioral Health and the conference rooms. Another area will go to the outpatient services. We'll have a pharmacy and medical services off of the hub, as well as our peer drop-in center. And so it really is going to be, like I said, that hub of service, whereas people come in, they should be able to find the services that they're looking for. So next steps in terms of the architectural design. We are at 50% design development at this phase, which means we have reached a level of the design that we're going back and getting a final cost study done. We should have that cost study back by the end of this week, and we'll know how close we got to that $60 million target. We're feeling pretty good about it at this point. We're going to continue working on filling that capital funding and really aggressively pursuing any opportunities that are out there. Our next step is also selecting our peer services provider and then the health services providers. And so we have work groups that are currently happening that are developing the language for that and getting input from peers and people who will be using those services to help us inform that selection process. And we're doing some work to prep the buildings for renovations. There's a lot of items left in the buildings. So we need to get that all cleared out and ready to go so that hopefully when we get our permits, we're able to dive right in on the construction. And then the last thing that's happening right now, which isn't up on that slide, is we have published the RFP to select the CMGC. And so we've had a really good response so far, lots of interest in it. And so that closes at the end of this month. And then we hope to select the contractor here very shortly.
Say that again.
CMGC,
Yeah, you
construction manager.
had a lot of acronyms there.
I'm
so
sorry.
Let's go back with the IGA to.
Okay. So we have a request for proposals out right now published to select the construction manager, general contractor that will help guide this process, and then we'll actually do the construction renovations on both buildings. And so that is out right now. Thank you very much.
You just said that really fast. So
I know.
Process there. So, yeah.
And with that, I believe we are ready for questions.
Questions? I'll defer to Catherine since she's remote.
Oh, and she always has questions as well. First, I want to say, good work, team. You have been working this project really hard for a number of years. And thank you for that. It's going to be an amazing addition to the suite of Washington County and serving really important needs of our community. And I only know that because you've taught me so. So thank you. If we could go to slides 6 and 7. Yep. So I appreciated hearing your explanation of getting to different amounts. But between these two slides, two questions really came up for me. And you talked about how the current estimate following schematic design is 62 million. And you've just defined a target budget of 60. Well, here are two concerns that I have. Excuse me. One is, I don't know what the contingency level is that you're building in. And then the second one is, I appreciate the CMGC process for value engineering and so forth, but I'm a little bit hesitant for a few reasons. One is we've seen how over the, well, gosh, I remember it coming up with the Oregon Zoo bond that I think was that in 2008? Escalation, concrete, steel, labor. So I'm really concerned that between 2023 and final construction that we're still going to have escalating costs. And so I'm like, ooh, schematic design, you're trying to get to another estimate from 50% design. it just lowering the budget to 60 million just doesn't feel, in my mind, doesn't feel sound. It just feels so ambitious that I feel like something that's really needed and important is going to be lost. So could you speak a little bit more about why 60 million and what about contingency?
Yeah, absolutely.
Not as you want me to be yet.
No, I can absolutely speak to that. So first of all, the number that is in the construction manager, general contractor RFP request for proposals is $36 million. And so the remaining amount that's filling in that $60 million are things like furnishings and our own staff and the design staff for CODA participating in some of the work, we have a long list of things, and I'm happy to give you our budget. But one of the line items, we have contingency both in the construction costs that are being included with the cost estimator, both, and then there's also escalation included in there as well. And then we have a separate contingency that we're holding out of that budget, that $36 million that we're holding ourselves. That's roughly 20% of the construction costs, just as a separate line item to really make sure that we're being conservative about how we're approaching it. In terms of the getting down from 62 million to 60 million, we've looked at things that are, we had some design features in the original schematic design, such as on the existing building, there are some kind of cut-ins on the walls that they wanted to flatten out and make it a nice straight line. And we realized that cost a lot of money to do that. And it wasn't necessary. It made it easier to place cubicles, but it really didn't have any functional value beyond that. So we were able to take out things like that pretty easily. And so that's by starting there and removing the things that were more on the wish list than really functional. We were able to shave a fair amount off and felt that $60 million kind of felt like a nice target at that point. So it is a bit of an arbitrary number. I'm not gonna, sugarcoat that. But we wanted something that we felt was achievable and still gave us a nice target to really, we still need to raise some funds and we're gonna work on that. Was there more that I missed?
No, that's it on that.
Okay.
I just have a few questions subsequently through, and I think you've already dealt with the hardest ones. When I look at the proposal for the Evergreen building, the now old Waka building, that workforce really seemed to rely upon on-street parking. And I just want to make sure that through the designs that you're working through, that there is sufficient parking for all the people who will work there, if there's any visitation or anything like that. So I just need to hear that having adequate parking is on your brain. And I know they're really confusing jurisdictional lines in there with Hillsborough, Beaverton, and unincorporated in that greater Tannisbourne area. So I just need to know you're on it.
Yes, we are. We've had parking conversations several times, and we're retaining the entire back parking lot for staff, and then we're having a front parking lot that'll be for visitors.
Okay, awesome. Then my last item is on the CMGC RFP that you've got out. I want to make sure that with these capital construction dollars, that I understand what our goals are for minority contractor usage and supporting of the apprenticeship program or apprentice utilization so that we can continue building the workforce from pre-apprentice up to journeyman, And, you know, just, I need to hear and see some more of that. And I'm longing for that. And I don't know how to get it and how to ask for it.
And my partners from facilities would be able to speak to this much better than I would, because I understand it's more of a strategy as a county rather than just this one project. And so
I expect it with all projects.
right, exactly. And so we are working and attending towards that. And we can have our, like I said, our partners at facilities respond in a more depth way about how they're working on addressing those issues.
In response, Chair Harrington, we can provide that to the entire board as a written follow-up to this meeting, and Kristen will transmit that information through our facilities team.
Yep. Yeah. Thank you.
Yeah, this isn't a nice to have. This is part of our commitment to equity, including in our workforce and in all of our capital construction. Thank you. That's it from me. Keep up the good work. Onward ho.
Thank you, Chair Harrington.
Yeah, I've got a few, but I'll defer. So I need to go back to some of the things Catherine was touching on. We went from 41.5 to 62. What happened?
That's an excellent question. And there are a few factors. The first cost estimate was very high level and it was not based on schematic design. It was based on our early, this is what square footage we think we need and, you know, to hold the programs and then going to a cost estimator. So based on square foot, when we actually had the schematic design where it detailed the programmatic issues, things like how many restrooms we were going to need, the fixtures, all those sorts of things. That was one element. The building ended up being bigger than the initial cost estimate. Once we had the schematic design where we were actually laying it out rather than just the initial space planning, we realized we needed some additional space. And so that was a contributing element. It ended up being over 5,000 square feet bigger than we had originally thought it would be. Another element is just the original cost estimate happened right before all of this inflation happened. And then the timing was absolutely the worst timing we could have had. So we got the second cost estimate after all of the major inflation, especially in the construction industry, had happened. And so that was a really large piece of it as well.
And I'm assuming, what did we pay for that building in Elam Young?
8.275.
Okay. So we've got in the 51 million that we have currently, we have the BH, behavioral health. I'm assuming that stands for
Yes.
reserve funds, 17 million, Hawthorne Reserve, 7 million. Does that deplete those reserve funds?
No, Nick, do you want to?
So we used $2 million that we had in Hawthorne reserves to, that was always set aside for the permanent home of Hawthorne. And we used some of those funds, 2 million of that, to purchase the building. Much of those funds are not depleted at this time, and we still have those in hand. And so our goal is going to be to absolutely dedicate these funds toward these projects, but we're really reserving them to be spent last and are spending all of the funds that we have related to other grant agreements that we have received, the opioid settlement dollars first, because they have more finite timelines. So at this time, we still have of those reserves, everything except for the 2 million that was spent from the Hawthorne Reserve still in hand.
So how much was the opioid settlement for, what is our share of that?
It's a moving target because new settlements come. Currently, we're estimating it at $28 million. It is $28 million, and it is front loaded, meaning we'll get a little more at the first 3 years, which is reflected in the $8.7 million there. And then in future years, the amount that we'll be getting is a lower amount, but we'll be getting that for another 15 years after the building is open.
Okay, so basically you're talking about an 18-year rollout on that money.
Yep.
Okay, all right. And then, I'm sorry, just one more question, then I'll shut up. On slide 9, you talk about how you're going to fund the operations of this program. And under clinical services, the second bullet point is state general funds to support indigent individuals. We're having difficulty trusting future state revenues on that. So is that a pretty significant part of your clinical services?
It is not.
Operational cost?
No, in fact, most of the folks that are in our community are insured at this point, whether it's through commercial insurance or Medicaid or Medicare. So it is a very small portion. And those state general fund dollars typically are actually federal block grants that are passed to the state, and then the state passes it to the community mental health programs. We manage those dollars, and so we'll be ensuring that those dollars are going to support the services provided at CAT.
Okay, all right. That's all the questions I have. Thank you.
Okay.
Good answers.
I just have a little question here. Is the Verizon cell tower on site, is that a significant source of revenue or?
It's $48,000 a year. It's enough to help.
Can you get another one?
We put sound array.
Phone is decided to ring in the middle of the I don't really have trying to pull my PowerPoint, but I don't really have a comment or questions, but maybe I do have one small question. You're doing great. You living and breathing this, so you're thinking through all kinds. I'm sitting here listening to your presentation, and I was like, how can I be helpful and help you identify where or how we can help you close that gap that you have? And one of the other slide, I think it might have been 2 slides prior to this, you had listed of where your numbers were. How are you crunching these numbers? That one right there, and then the red. So I didn't see the CCOs, but this prompted when I saw Care Oregon. Could they be potential? And how can we help as a board to figure out how we meet this? Because this is an important services, and this facility will be so helpful to so many people in Washington County and beyond who are struggling with, substance use and addictions, and providing comprehensive and individualized treatments. That just, there's power in that just statements that you're saying. So that's the small question I had for you, is just to see how we can help, and where does Care or the CCOs fit in this? And do you have any strategies that is there conversations that are happening?
And we're partnering very closely with our CCO partners on this. This slide shows that Health Share and Care Oregon have given us $7.6 million grant toward this. And really at the time of them awarding that grant, they thought that they were closing the gap. That was really, we were operating off that $41.5 million figure. They wanted to get us to the finish line. And so they are at the table, they are partners, and they're really committed to funding the services ongoing once CAT is developed as well. within the healthcare grants $1 million line item, that includes grants from both Hill CCO and also Trillium CCO as well. So they've each of them have contributed thus far to the capital investment of CAT, and they've also been an active part of the RFPs that we've run to select service providers, and also the analysis as far as how do we ensure that we're receiving operational funding. So they're at the table, they're partners. We're going to continue to work with them and let them know that we have this gap in place as well. And so we would welcome with open arms additional contributions that they made. And I think as we get closer to the finish lines, those are conversations we might be having.
But Care Oregon is a health insurance, right? Like, isn't the CCO's health share? Is that one? Health Share of Oregon, HSL, they're combined together?
So HealthShare is the
Yeah.
largest CCO in.
Is there another one or no? That's it in the Tri-County?
So we have three actually in Washington County. So HealthShare is the largest by far in Washington County. They have well over 115,000 members right now. Trillium Community Care is a smaller CCO, and then we have a very small number of members enrolled with Hill CCO. Care Oregon actually manages the full behavioral health benefit for HealthShare, and so all of the behavioral health service costs, from outpatient to residential to withdrawal management, substance use disorder treatment, are all funded by Care Oregon. So HealthShare receives those monies, and they transfer them or pass them off to Care Oregon to manage.
Okay, thank you. Yeah. I mean, if HealthShare can double that.
We would love it.
I think that would be- But I would have liked the Care Oregon and the HealthShare be separated, because I'm sure they have both money, but you're doing great. Let me know how.
Thank you.
Can I go back to one question? Sure. Just looking at 15. I see SHS in there.
Oh, yeah, another acronym. I apologize profusely for the acronyms today. So that's supportive housing services. And so the goal is to have this be an entry point into the supportive housing services system as well, by co-locating some staff, especially the front door staff, into that system.
So are we going to be inviting homeless into this environment? Maybe looking for services other than what you're providing there?
I would say that our houseless community needs all of these services anyway, and they're already coming to Hawthorne. They're coming to our building already. And so this is just an opportunity to make sure that we can be very responsive to them when they are coming on site.
Yeah, I completely agree with that. That's what I like about this program, is that we're going to provide those services. I just didn't realize there was going to be a space there.
Yeah.
So, okay.
Yeah, that was very important to us. We really want to share the work and the support to our community.
All right. Perfect. Thank you. Thank you, Roy.
Yeah, my only comment was, and I certainly have not done a deep dive like you have on a daily basis, but I look at your revenue sources and it looks like you've drained everything to get in here, and you still don't have enough. And you probably made lots of comments or recommendations to those who are funding you. Gee, we're almost there. I don't know what that means in terms of long-term strategy, but I like Jerry would he mentioned something early on that I have always agreed with, and that's sustainability. And it's just from a uneducated outside look in, not your viewpoint, because you guys are doing the work. It just appears like we're stretching a whole bunch. And I just wonder whether the money will be there. You certainly understand the financial condition of the county and what's going to happen to sustain these programs. He was kind of picking at that, and you're saying, well, I think we're going to get money from here or there, but if the state finds themselves in any kind of a difficult position, then what? I mean, this is massive. When we bought that for $8 million or $9 million, whatever the number was, it escapes me, but I don't think any of us had that kind of a vision. Not that it isn't great, not that it's not needed, not that we won't use it. It's just, can we sustain it? So I hope that the answer is yes, and that we're not looking at what was $1 million in interest earnings or something. I mean, that's picking at the bones of the carcass. I mean, we're just trying to find money anywhere. So I don't know. It concerns me, but I guess you all will come up with some answer for it, hopefully.
That's our plan. So just to be really clear, our gap is in the capital. We are fully funded when it comes to services.
How much general fund support do you have
None.
in any of your programs? There's no general support anywhere.
That's a good answer. Did Tanya give you that answer?
No, that's based on board direction as we've been through the financial planning of this project. And that's why it's important to continue to come back also to the board with these financial updates, because this is a large project. The team is being very creative and opportunistic. And even to the point of really learning from where we've been, the facility condition, making sure that our roof is solid, HVACs are in place as we invest these capital dollars. And if there's any gap, that's continuing that conversation with your board as we move forward. From an operations standpoint, they did speak to the operations. Also, the operations is being planned for. Let's say hypothetically, one of the sources changes in the future, the operations would scale back. So we would not be operating portion of the facility. So the team has planned for those scenarios if in the future some of those costs do go away, because the direction has been planned for this without general fund support.
So if I could wrap that into just an understanding that you're planning on a self-sufficient, it's almost like an enterprise fund, not exactly, but you're getting monies from outside sources. No general fund support, so you understand that if money gets cut, then you shrink your service.
Correct.
Yes.
Correct.
I didn't miss anything in there.
Nope. Nope.
Great, all right, good luck.
So just one more question, staying
Sure.
with some of that. Nafisa, Pam and I visited the mobile methadone clinic. And they were saying, and I've asked you this before, so I apologize, but I'm gonna do it again. That they would like to have space in this building, but they can't because they're a profit center. So so putting someone like that in this facility is not in the plans and or not allowed, or what is that?
So it's not that it's not allowed, it's not planned at this point. We are working with CODA, which will operate the intensive services, that they can do some methadone induction, meaning starting people on methadone when they're in the programming there, but then those services would transition to an outpatient provider. And we haven't had conversations about offering methadone out of either of the buildings on an ongoing basis. Those services are available. There is the mobile van. And so that wasn't a priority at this point. In the future, if we feel like that becomes a priority and we need to shift clinical models, we can look at that, but we're not feeling like that is the priority at this point.
Well, and I think part of the issue is that they have some patients who pay out of their own pocket, but for the most part, they're covered by insurance. And we're talking about that not being a barrier to entry, so to speak. Even if you don't have insurance coverage, we're going to take care of them in
Right.
it. So, okay, I get that. Okay, I'm sorry, Pam, I got to add it.
No, and thank you for asking that question. And the real question is there any cost benefit to us to work with them? That's really the direction I think that the question was headed.
Gotcha.
And I had a question, the comment in my head, when I heard you just say what you just said, in the future, looking clinical models and then adjusting it as we see fit. Does that make us reactive rather than now? Maybe it's the opportunity to be proactive and think ahead.
I think that it's going to be both, right? So I think over time, we wanted to build this building with as much flexibility as possible so we can expand services and contract based on community need. One thing we do know more than anything is that the face of substance use disorders, the different drugs that are out there, the things that are really prevalent, it changes. And so we want to have a building that will allow us to modify our services to be responsive to whatever comes next. And we can't necessarily predict that, but we know, I mean, we wouldn't have predicted that fentanyl would be as lethal and prevalent as it is right now. And so that's what I mean by that is it will be a little reactive, but at the same time, hopefully we're able to be forecasting trends based on what we're seeing and make adjustments, whatever our community is needing at that point.
Okay. Thank you.
Sorry to cut it off, but we've got other people who want to chat this afternoon.
Okay.
We got
Thank
more
you.
exciting financial stuff coming.
That's right.
Greg.
I've been waiting for that.
Thank you for this thorough presentation.
Thank you all.
Thank you. You want it or take a break? Is that what you're saying?
No.
Oh, Are you saying you needed to?
I can hardly wait for Greg.
Oh, cut Greg and yeah.
Capital improvement. plan.
Yeah.
I think my last comment, I forgot to use the mic, so Chair Harrington, I hope you were able to hear us.
She could.
Does the chair have these?
We'll get her. Actually, I think she already does.
Wait, are there handouts? Is that what
Did
you're
you?
getting at?
That's why I
Yes.
was asking if you had them.
Chair Harrington, you actually have all of these already, but we've got a paper copy that will get to you right away as well.
Yeah, this was in the package down at the bottom of these documents, wasn't it? Wasn't this in-
No, this is the revised, right? Yeah.
No, this is just some additional information from the December 13th questions that came out of December 13th packet. So, right, good afternoon, commissioners. For the record, my name is Greg Munn. I'm in the county finance office, and we're here today to talk about the capital improvement plan. And I just want to give you an update on where we're at with the plan. Last time we met was December 13th. And at that time, we had an opportunity to talk about the proposed plan and the direction where we're going. And today is the result of that work. So today really marks the culmination of that effort to bring together the county's capital improvement projects under one plan. And it's really a summary of our major capital expenditures that have been identified throughout the county in a variety of departments and functions, including our friends in ITS, facilities, transportation, and the fair complex. And what constitutes those projects going on in the capital improvement plan is that we have an identified funding source or close to an identified funding source and a prioritization of those projects that identifies a timing of those expenditures over the next 5-year planning horizon. In addition to that, to make sure that we scoop up everything, we have a separate planning list that includes projects from those different areas that don't have necessarily an identified funding source or a prioritization in terms of timing. So these are some of the projects that are the result of our master planning work. So we keep those on a separate planning list. When they have an identified priority and a funding source, then they go on the CIP. So the goal here is really to make sure that we're capturing all of our future capital, whether it's in the next 5 years or beyond, and just continue to update that as we move forward. The handout I gave you, one on, I'll show it to you. I'll show it to you. It's on the back, has lots of projects, many pages of it. And you'll see lots of details. That's the planning list. So those are the projects that aren't on the CIP, but are still within the scope of a future CIP. Also on the handout is a list of all of our building or all of our locations in the county building locations. This was a question that came up in December, the December 13th meeting. So we wanted to give you a copy of that. It's not just the downtown core either. And then there were some questions that came up at the December meeting as well, that there's questions and answers included in the packet. And we can send this out to you electronically later as well. But I want to make sure you got that to you.
And Mr. Munn, we will make sure that these are included in the packet and updated for the public as well.
So,
I have a question.
yeah.
Greg. Looking at these documents, the yellow highlighted pages, it lists the CPI project number. What's the significance of that? Or is there a list that we're to be looking at where that number?
Those were just numbers that were assigned to these projects. So you can imagine, and these don't have a timing yet priority. But as they gain a timing priority, so as that we bring them off the planning list and onto the 5-year CIP, we'll try, that number will be the number we use to track it. So what I have the privilege of sharing with you today is the sum of collective input from across county team, including staff from ITS, LUT, the fair, facilities, and budget staff. But I want to make a special note to point out Theme Grenz from our ITS department for his role as the hub in the project. He's probably listening here and glad that I'm not asking him for something else. But Theme is really key in keeping us together as a team and moving this project down the road. Okay, so for today's agenda, just a few things is to give you a little bit of backup in the process to date, which we've talked a little bit about it so far. We'll review the 5-year capital improvement plan, one presented here for your review, and then we'll talk about next steps, where we go from here. So some of the questions about why do we have a CIP? Why is it important? And I just have a few slides to demonstrate that. This first slide here, you've seen this before with our GFOA work, and identified in the lower left-hand corner is a capital improvement plan. It's a component of our overall management system and is a key component in the relationship between our strategic plan, our master plans, and it fills the gap in between those two and our actual capital budget moving forward. And really also plays a role in our operating budget because much of our capital improvement projects, many of them, come with operating expenses down the road, just exactly like you were asking about the CAT project. We're going to make this $60 million investment. How are we going to pay for that? Are those expenses covered into the future? Another reason for a capital improvement plan, like I just mentioned, is it on this next slide here, is it links together our master plans. So our master plans are going to generate a significant amount of things that we should consider in terms of program, capital, outcomes, all of those sorts of things. We want to make sure we can capture that all together where it's possible. So on the capital side of that, those projects that are in a master plan that have an identified priority and a funding source go on a CIP. Those that don't yet have that would go on a master or on a planning list. So all of that information from those master plans is important and it feeds into our capital improvement plan. You could also draw another bubble down below the CIP bubble and call that the adopted budget. That would be the 1-year budget. Another reason is that multi-year capital planning is the best practice as identified by the Government Finance Officers Association. Referred to that before. It's also a 5-year projection for our capital program is also called out in our county charter. And that leaves us to where we are today. I won't go through all of this on the screen, but I would like to say that this has been a multi-step process. It's involved a lot of people along the way, well before my time, and it's been a work in progress. And I'm just happy that I get to sit here today as we get towards the end of it and actually have something that's produced. So our last meeting was December 13th. And at that meeting, we discussed what an overview of the capital improvement plan, its purpose, what it is and what it isn't, how the CIP aligns with Design the Future, our One Washington County and the county's overall management system and the future strategic plan, the timeline for the completion of the CIP, the integration into the budget process and a funding plan, a review of the initial draft work in the progress CIP, and a review of our critical facility projects as identified as part of the development of the CIP. So the next steps in December was to bring back a critical facilities funding options, which we did at the January 24th work session. Draft a CIP policy. This is a future initiative that we will do in conjunction with other financial policy work. And then to develop a multi-year CIP for board approval, which is where we're at today. So the next 3 slides after this, we're just going to roll into a high level of the CIP. We've shared this before, but we have a sort of a leading slide here, which is our main campus, downtown Hillsborough. But what's interesting about this is I actually compared this picture before I got here with the list that I just gave you. And it's interesting what the scope of our facilities is beyond our downtown campus. It's quite broad, kind of an interesting comparison. So
What you're calling downtown campus is all these different blues.
it would be this area between, I can't read the streets, but probably Jackson Street down to below Washington Street.
Okay.
Do you see it there on the screen?
Oh, okay.
Yeah. But the list that I gave you in the handout is much broader than that and has a list of all of our facilities countywide, not just in the downtown area. So for facilities, these next 3 slides are just high level summaries of each of our 3 major CIP categories: our information technology, our facilities, and our transportation. And so although I'm showing these to you separately, I'm only doing that because it's easier to get our arms around it. They're really all part of one summary plan. And if we have questions on anything specific, we have our department heads, experts that are here to answer those questions. One thing I would do, or would just point out here, is if you look at the top line on the expenditure, we just talked about CAT. And that happens to be the first project on the expenditure on the facility side. And you'll notice that number is $60 million. So the hope here is we talk about the CIP moving forward, and you have the opportunity to hear about other initiatives in the county that'll come together both on a budget side and on a CIP planning side.
And Greg, I see the chair has her hand up.
Chair Harrington, sorry.
Well, and I just wanted to start with, do you want us to ask some questions now about what some of these line items are, or do you want us to wait later? Or do you want us to just say, I need a one-on-one because I've got some questions about what some of these things are?
Okay, that's great. Thank you. Why don't I go through these 3 slides and then we can ask one-on-one questions and I can bring the experts up. Okay, so facilities, just a couple of things I want to point out here is that we are showing the funding sources down below here. And we do have this one line second from the bottom, which is to be determined, the TBD line. And that line right there relates to, and it shows further in the detail, but the detail is many, many pages long. It's those dollars there of to be determined funding that we haven't identified yet specifically are related back up to the critical facility infrastructure work, which is the second project from the top, which we've been talking about as part of the ARPA funding proposals, and also the seismic upgrades for the Walnut Street Center that begin out in FY26. So I just want to draw that relationship there between those 2.
What about the blank one? It's a small amount, but expensive.
Oh, okay. We're looking at 2 different sheets here.
Oh, we are? Okay.
No, that's okay. You're right. Yours was updated. That is the fairgrounds. We made an adjustment from when the presentation was originally posted. And this was a mistake that we didn't correct, but that is the fairgrounds perimeter fencing replacement. And the offsetting item at the very bottom is a state grant that funds it. Okay, the next page is our transportation project work. And you can see that because of I think there's probably 7 or 8 pages worth of projects that they're all combined together in one line item. But the funding source has been identified for all of those projects. And you can see that the bottom line is zero, that CIP is balanced moving forward. And on our information technology service projects, we have a to be determined funding on the second from the bottom, and that is tied primarily to the replacement of our enterprise, our ERP system, our financial and HR system, and also to our project line that funds our regular ongoing projects for ITS, 250,000. So we don't have those dollars identified yet. So in terms of next steps, today we reviewed the final draft of the CIP. In the future, we will come back, the board approval, or today what we would ask for is board approval of the CIP. And we will bring that back for a formal approval at a public meeting in the near future, in the next couple of weeks. And then we will work on developing our capital improvement policies as part of our financial policies in the next year, and also formalize this process with our team moving forward as we integrate this into our budget process in the next year and beyond. All right, any questions?
That concluded, but I think. Catherine, did you have questions now?
Could I hear other people's questions first?
Sure.
Thank you.
Whatever you want to do, yeah. Jerry, do you want that?
Yeah, a lot of stuff here. It was interesting to me to see, and this document helps me see it a little bit better, but the number of facilities that we have, it's pretty phenomenal. The courthouse, I noticed in the courthouse numbers, you have, and I gotta find the slide here. You have actually 2 numbers in there. One is what it looks to me like to build the thing, 400 million. And then a seismic upgrade to it at 15 million. So I was wondering, what are we gonna do, one then the other, or why aren't those combined?
I think I'm going to ask my experts to come up.
Okay. And I gotta find that goofy thing. I don't know if it was in here or if it was in the slide. Sorry, I should be able to point right to that. And so can I ask you one other thing while you're looking? What's in the first column, Greg, over here, what does UI stand for?
That's actually a facilities term that we use. It's unique identifier. It's just something that we use to timestamp the projects as they are daylighted and captured on this list that we maintain internally.
So there's that's a reference to another list, is that?
No, it is just this list.
Just that,
Yeah,
it's code.
it's
And
code,
I
it's
can't-
secret
You can't tell
code.
me the code.
There's no code. It's just the order that they were added to the list.
Okay, all right. No, it's not important. I just wondered if there was a reference. So what I'm talking about in the courthouse is on page, well, wait a minute, there's no page. So
I think it's page 2.
it is 1, 2, yes, page 2, and it's the third item down. Courthouse construction, 400 million, and then 2 down from that is the seismic upgrade. So I was just wondering why those are separate.
I believe those are separate because the construction refers to the effort to provide a new courthouse, and the seismic upgrade is to upgrade our existing structure.
So how far out is the courthouse projected, the new courthouse? Because I'm not willing to spend $15 million on something that we're going to tear down in 5 years.
Correct. So the list that you are looking at right now that's the planning list. These are all projects that have been identified as a future need, but are not within our 5-year horizon. So there is no immediate decision required on that 15 million. It's more of an awareness that should the planning efforts come to fruition and leave us, or if county decides to keep that courthouse forever, then we would need to invest 15 million in seismic upgrades at some point.
Okay. Then just one more question. Why do we
Commissioner
have?
Willie, to maybe add to that. So if you recall, the board on your board initiatives had a list of facilities that were known to need to be on a further list and even have further plans developed. We have not started a courthouse planning. So does the courthouse stay? Does it move? This is just an attempt to have it on the list.
Mhm.
Once we proceed with the actual courthouse planning, then those dollars will be further refined into an actual project. Right now, we're just trying to capture it on the list that here are the things we need, here that projects we have to be cognizant that are looming out there in the future of unmet facility needs in
Yeah,
Washington.
And I completely agree with that. We want everything on the page. So why do we have transportation projects on this? Future transportation projects. Why do we have those on here?
They're identified in a transportation plan, similar to a facilities plan.
Isn't that MSTIP money?
It could be. Mhm.
There's multiple sources
Multiple.
of funds that fund our transportation projects. So this is a planning document to plan for our transportation fund projects and to be transparent about here are the projects that we're completing, similar to how we're planning for facilities, similar to how we're planning for IT.
I guess.
And there's multiple sources of funding across all of those projects.
Yeah, I guess I didn't expect to see transportation in our CIP. But okay.
Yeah, transportation, I would say, from my experience, is really a foundational element of any CIP.
Okay.
So page 10 of the slides, or slide number 10, I should say, is a good example of the variety of funding sources that go into paying for transportation.
Okay, thank you.
I'm absorbing. Thank you.
There's a lot here, you're right.
Yeah, I'm observing, I'm trying to figure out, like, this is great information, and I'm sure you're doing your checkoffs and crossing your T's and dotting your I's. But this is a lot of information, and I would hate to ask for a pause because I haven't really, I guess, I don't know the significance of this more than 10-page document that you just handed to us. And I want to make an informed decision so that the thumbs up I give you, it's something that I can live when. I'm sure we can reevaluate. But then the bigger question I'm grappling with is, like, what's the framework? Like, CPI is supposed to provide us a framework for decision-making regarding capital investments, and I'm not sure I am clear on that. So maybe this is what the chair was saying earlier, like maybe I asked for a one-on-one.
So we can certainly do that, but maybe I can take a swing at summarizing it really briefly. So the purpose of the CIP is to take those major capital projects, those expenditures that the county has that are beyond our day-to-day operating expenses, that are going to occur over the next 5 years, and identify not only what the costs of those are, but the funding sources or lack of funding sources so that we can start pursuing those. It's really saying it's not just looking at this next year in terms of our operating budget, but let's look ahead a few years. And because some of the expenses get to be pretty significant, we want some lead time in preparing for that. So that's the purpose of a CIP. The other document I gave you with all the projects on there that's not part of any sort of a planning document. They're just projects that are on our lists that could end up on the CIP in the future, but they're not now. And the reason why I wanted to share that with you is so that I gave you the confidence that we're somewhere on a list, including everything that we know about right now, whether it's within the next 5-year horizon or whether it's something that's not yet on the 5-year horizon, like the courthouse.
So it's looking at what our risk is here.
Yeah, certainly. Yeah. Did that help?
Yeah, and I think I'm trying to tease out, I get the funding sources and identifying our capital needs, but then when does the prioritizing happen? Prioritization, like when does that take, like what are we prioritizing?
So the prioritization really happens over multiple stages.
After this decision or?
It ends up, this is part of the prioritization
Okay.
process, I would say. Another part of it is even before this, part of the master planning. When you look at the big picture and
Mhm.
where we want to be in 20 years, the strategic plan is another component of the prioritization. Probably where it comes down most directly for the board is during budget adoption. It's that next year's budget. What are we approving? What are we adopting in our budget to be dollars to be spent towards capital and towards operating? So the 5-year plan, CIP, you could almost see that roll each year as it gets closer and closer as we move forward until it becomes the next year's budget request.
Short answer is when we prioritize it when it breaks.
Whoa, 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 whoa.
That's not true.
I'm going to interrupt here if you don't mind, Vice Chair
Please.
Rogers.
Please.
Commissioner Fye has asked a really pivotal question. This is the first time this agency is assembling a capital improvement plan and a first time ever comprehensive future projects list. Okay, remember a couple of years ago through the board initiatives document, I inventoried all those things that we started getting presentations on back in 2019. Some of those things I think are still missing off of that list. So on your next step slide, it's almost like a little bit too rushed. We're reviewing the first ever assembled capital improvement plan. And I'm hearing a couple of my colleagues, at least a couple, saying, whoa, we need more time to absorb this. And I'm right there with them. So I think we need a second step of being able to really understand this list and know what is referring to. Then I follow you, Greg, that the way that the elected board, whether it's a city council or a board of commissioners, would weigh in policy-wise, right? It's our decision as to when we actually program in those dollars. Staff provides some input to that, but at the end of the day, we have to determine where we put our total thumbs up in terms of planning out these assets. And in this future list, it's a little bit not clear, or it feels a little too glommed up because you say approve the list, but that's separate from the budget. And you just articulated that process-wise, it's part of the budget. So pardon me for pulling up the card that says, confusing. I think today's meeting is really awesome to share this information, but I think we need a little bit more time. We need to get a little bit more sorted in terms of what are these steps moving forward. But it all comes back to that really valuable question Commissioner Fye asked about is, so how does all this get prioritized and decided? And I can't see a single person's face to know if I just talked right over everybody's heads or not.
Thumbs up for me, the suggestion you just made, Chair Harrington. So I'm in that bucket. I'm so sorry.
How about you, Commissioners Treese and Willie and Rogers?
Well, why don't I make my comments and then you can come in. We're all absorbing this. First of all, the action that you're requesting is to approve this list. That's what you're saying, a CIP program. You come back with a list of projects and you say, we need to approve the list. That's what I heard. I don't have any basis to approve it or disapprove it. I mean, it's, your professional staff, you've come up with a list and I presume it's correct. I mean, that's, it's just a list. That's all it is. So that part of the action, I guess just personally, I don't have a big deal with it. That's it. There's other actions that's being talked about. One is how do you prioritize within the list? That's a different question that I agree that we could talk about later. A suggestion I have, and one that you're disaggregating many funds, and I've complimented you on that. I think it's important to do for full transparency. On a CIP program, we really don't do a good job of disaggregating where the assets are owned and who's going to pay for what. And let me give you a good example. A business may own a business park of which they're a tenant in, and then they have all kinds of other tenants, and they may have their business, but they don't mix their business up with the ownership of the business park. And so what's it got to do with what we're doing? To me, all the facilities, I'm not talking about road, that's a different issue. Capital improvement program, I get it, but all the buildings should be owned by some common entity, which is the county. We're the landlord, and every department should pay rent for their space. If you really want to get down to full costing, that's what you do. And so the county, as the landlord, would pay for their space, and each department would pay for their space. And so that's an accounting nightmare. Not so much. I mean, I happen to personally do that on properties I have, and others do it as well. But that's the true measure of what the cost is. So if a department says I can't afford my rent, then the general fund gets to decide whether they're going to subsidize that department for that space. I mean, that's really what happens. You're not doing that because you're aggregating. You've got this big pool, and you say, well, how do we decide what it is? If the sheriff's department, for instance, I'll just pick on them. If they have a lot of capital facilities, they don't own that building, the county does. County charges rent for it. If they need certain improvements, you know, their rent might go up to pay for that, to finance it, or we may decide that we're not doing that. I don't know how you move out of jail, you don't, but you simply say, what is the general fund willing to subsidize? So a pure capital improvement program of a bazillion projects, do I approve it? Of course. Do I disapprove it? Of course. Yeah, I don't know. I assume it's right. I don't know what's in there. I mean, you gave it to us just now, and I mean, it's very comprehensive, and I trust you. I know you do a really, really good job. So that's just the number one question. But playing off the chair's comments as well, the question of approving a list is not the issue. The issue is how will those costs get paid for, in what time period? So if you really want to do true cost accounting, and I'm speaking too much, I'd treat it just like any landlord would do. I got a bunch of facilities. I'm leasing them out to a bunch of folks. They just happen to be departments. Or if I own 10 businesses and I had 10 businesses in there, I'd lease them out to every one of my businesses. I'd charge them a rent, and they would decide whether they could pay that. If they couldn't, then I have to decide what the rent's going to be. Or in our case, as a government, I would say, that's my general fund subsidy. So we're really not truly costing out our costs on those things. We really aren't. Not your fault. We've never done that. Most governments have never done that. There's a few who do it. I've seen it, but it's usually just selective. But that's the ideal. If you really want to get to the ideal, that's where it's at. So that's my comment. So with that, I'll jump back to the chair because she wanted to be last.
Thank you. I appreciate everyone's patience. I spent my time through the weekend going over the prior version of the sheets. So I was trying to use our time here to catch up with the new version that was in the packet as of yesterday. So I'm working through it, and it's gotten a little bit, my assessment has gotten a little bit better than just a few minutes ago. So I'm pleased about that. Because when I get such an adjusted volume of information, it makes my head spin. So I do have a few questions. I'll start with what I think is the hardest one, or the hardest situation I have prior to my specific questions. And that is on the part CIP. And I haven't known where exactly to raise this with, oh, good grief. Now I can't find it with this latest version. With the prior version, we had a sheet that was just park CIP expenditures and revenues. And now I can't seem to find it in the latest packet. So
I believe that the parks CIP was removed from the latest package due to uncertainty involved in the funding mechanisms.
okay, so Ms. Angie, will we be coming back to the whole parks campground question and the metro local share?
Yes, staff are working on scheduling that for a work session and then ultimate board approval on
Got it.
the metro
Okay.
local share. This also gets into revisiting the campground conversation and what it would mean for Washington County to operate a campground. So we will be also bringing back that as part of the work session, and that's why scheduling it for a work session, because staff are assuming that commitment to any capital expenditure that would increase operational, I'll say, kind of footprint or maybe
Yes.
perceived operational
right with
footprint
you.
will lend itself to a very, I'll say, different conversation than maybe even your board had a few years ago. So
Yep.
we're
right
being
there with
thoughtful.
you. Yep. Okay. Yep. I have yet to meet a campground that covers that's publicly owned, that covers its own costs. So, well, that took care of that question. The West Side Commons. Oh boy. Now, once again, this is two different versions. The bottom line, I need a little bit more time to catch up with this. But it also goes to on that next steps board approval. So, so the information that I have, the old one in paper with me, so I could navigate the conversation in real time, but also the electronic version. Where I have a hard time is seeing descriptions that say just project or just TBD or blank. So for example, on page of the packet, the electronic packet, page 75 of 132. If what you say we're going to be adopting relatively soon is still going to have lines that say blank, I'm uncomfortable with that. Just like on that same page, and I assume you're with me, though I can't see your face right now. Under revenue, what is a BER?
Oh my goodness, I had the same exact question earlier, but I was
Yeah,
afraid to ask
so
unless I missed that information. Yeah.
I'm not afraid of looking stupid even in our public meetings, I guess.
You're much more braver than I am.
So this is where I think, since this is the first ever that we're establishing, we're all trying to catch up and make sure that we're comfortable with what the information is and how it's proposed to lay out over the next 5 years. So I tell you, I mean, I'm really pleased to have this information, but my head's spinning a little bit, partly because I've been trying to deal with 2 different versions. But also it goes to my high sense of responsibility that I want to make sure that we've established a good base so that next year we're able to say, okay, we have some new information. For example, from the study from Animal Services that's supposed to come in and be done in actual through fiscal year 21-22 or current, darn. Anyway, I think there's some more information I'm supposed to be able to understand, and I don't right now.
So I would maybe suggest as a next step that staff schedule one-on-ones or two-on-ones with commissioners and gather your questions. This is really a work in progress, as many of you had called out. This is the county's first ever capital improvement plan. And so this is a journey. And so taking this step by step to adoption. I also want to acknowledge that the board will be getting our facility condition index, and that will be coming back before your board at Q4 of this calendar year. That will be another data point that will further inform the CIP going into next year. I would fully expect, I'm anticipating in the CIP, there to be identified priorities that are unfunded right now in the 5-year CIP. One of those being our ERP system, our enterprise resource management system, planning system. We don't have a funding source, and that's a critical need. Does this also get us to additional financial conversations? Commissioner Rogers, you were talking specifically to facilitate, like how do we charge for facilities, both on an operational standpoint to just from the daily maintenance and operation of our facilities to the long-term capital maintenance. That also has to be part of evolving conversation. So I think staff can also work on further clarification of what is the action we're taking now and how does that connect to some critical next steps. In my opinion, especially for facilities and IT, I just want to we do not have funding for large capital investments. It's just not there. So we are going to have that continued conversation, but we can work on some of that. So maybe as a key next step, we schedule one-on-ones with each of you. This allows time for you to further review the information, kind of collect thoughts, and we can refine this and determine what are the steps for us to move forward the process of capital improvement planning here in Washington County and be really clear on what we're achieving in this first step and what still is outstanding in that process that we need to address in the future.
That makes sense to me. Could I ask a quick, pretty simple question? I didn't understand how this data was organized, and it looks like it's organized by project description, which doesn't make much sense to me. But that's the only way I can see how the list is organized.
It's actually organized by the project number, that FAC number at the beginning of each line. And so and again, being
They're not numerical.
They are numerical. They may skip a few that were removed
mine.
at some point, but
The UI.
oh, the UI. The UI. That's our,
The only, on this,
I got you.
the only place
You're
here
right.
that it makes sense that the way it's organized is but under project description.
That
If you
first letter.
start with the third one at acquire, everything else is alpha by the
wow.
first word.
Yeah,
So
that's unintentional. I apologize for
Okay,
that. They should be organized by
Good catch on
building.
that.
Well, I just couldn't understand
Yeah,
how,
don't
I
you
didn't
just-
understand how it was being
Yes.
presented.
Yeah,
No,
that's an error, and it should be organized by building without any prioritization at this point.
okay.
That's
Because
how
I
it
think
should
that would
fit
be more
behind the
helpful.
scene. Yes,
obviously, when we're
agreed.
looking at these. It
Yes.
just, there was no way to pull it together for me.
Agreed, that will, yes.
So it sounds like what we're gonna do is you're gonna have some one-on-ones, one-on-twos, however you wanna do it, come back. The central question I had, is the list going to change at all? I mean, have you identified all the capital, how we prioritize them in the future, how we fund them, is that list going to change?
Yes,
Okay.
it will change. It will change. It will be better informed. I'm going to say after we receive the facility condition index.
All right, but it won't be different projects. I mean, you'll just give condition, you might organize it differently as I'm pointing out, maybe the organization isn't the best, but are you adding more projects? Is that what we're gonna say?
So when I think list is a confusing terminology. So when we look at that list that starts with the UI number, the unplanned things, that's a larger database that we refer to as a deferred maintenance and capital improvement list. And that's supposed to be a comprehensive catalog of need across the county portfolio. And we will certainly add, we meet quarterly to review that list and we add to it every time. Because there's always something new that comes to light just through our everyday travels.
But by the time you're asking us to adopt at some point, that's why I said I didn't care if we adopt or not, as long as we had all the projects on there. What we do with the information is a different question. But you're saying that this is going to be evolving, which it would. I didn't see any depreciation of this, so it's not like I'm used to seeing things where you forecast out what you need in each period. So you're not doing that. You're not building up any reserves. I get that. But you're saying by the time this board has a briefing and we are adopting some process, the list's going to change again.
What I would, and I think Greg is better prepared to answer this, but what the board adopts is the 5-year funding plan known as a CIP. So the long table. Yeah, not that long list.
Okay.
That's just the shopping list that we create internally to refer to and catalog our need.
Get confused.
No, it won't be different every month, but the projects that we learn about will change.
I get it.
And they will change the moment after a plan is approved. But the purpose of this is to keep track of these as we move forward and to be able to update this as we move forward with two things in mind. One is to make sure that we're thinking about funding this work 5 years out, then 4 years out, then 3 years out. So that by the time we get to an adopted budget, as we roll into the FY24 budget, we've been looking at a lot of this work for several years and we've identified the funding sources to actually bring those to the board for formal adoption. So it will change, particularly the out years. Our crystal ball is a little more murky as we go out further, as we know more about our facility condition index and some of those sorts of factors. We're using technology to be better at forecasting. Ideally, we would see less variation. That's the goal.
I'll get to Catherine in 2 seconds, but I understand that entirely. It's like fair market value of investments. Every day they go up and down. So I understand that, but I'm just hoping that we'd come to a point in time where this is the list and we adopt that understanding that's evergreen and it's going to change. And you're saying, yes, we're.
Yeah. So in a part of our overall budget process, and this is the beginning of that, is that we would ask the board to approve the CIP.
Okay.
The FY24 component of the first year of that CIP would become part of the budget that we bring you for adoption later. Mhm.
Okay. Chair has a question. I see your hand. Catherine.
So, what I hear is that we're agreed that we're trying to move to an adopted CIP. But from what I'm hearing, we're not all in agreement on the other lists we're trying to get agreement on, okay? Specifically, this future projects list. This board has been very patient since January of 2019 with hearing various departments come in and say, here's our list, here's our shopping list, here's our wish list, here's the state of affairs. And along the way, we've learned that there were certain lists kept in certain desks that the board was not aware of at all. So what the point I'm trying to get to is, can we have a clear picture of our CIP? So those projects that we have a finance plan for the next 5 years, and our current futures project list. Yes, I agree with you, Greg, and others, that will continue to evolve. But we have to get to one standard wish list right now versus, since we have 2,300 plus employees, we cannot afford to have over 2,300 plus different wish lists. We need to get to some standard agency lists. That's what we're trying to get to. And now I'm really frustrated because I've got like multiple lists and multiple iterations, and I would really like to understand what model we're trying to get to. And I'm from person to person, I'm hearing different things we're aiming for. What I'd like to ensure is that with our next step, that we document what some of our vocabulary is and what we're going to, what that understanding is that all of us in this agency need to have. Or it's going to continue to be very messy. And I'm tired of 6 years of messiness. It's time for us to get to some clarity and then plan from there. So I think there's tremendous work here. We've got a lot that we didn't have before, but process-wise, I am just getting more and more confused as this meeting goes on. So that's why it's like, stop, let's come back.
Thank you. It sounds like you've got a plan to come back and plan to re-engage with this. Does anybody else need about a 5-minute break? If not, yeah. All right, why don't we take a 5-minute break and then we'll come back into the urban road maintenance district discussion.
Maybe more than 5 minutes.
Yeah, 5 minutes has never worked for this bunch.
Yeah. Oh, you heard.
All right, 2 minutes.
We'll resume at 3
15.
o'clock.
Yeah.
Yeah.
3 o'clock, you need to read that much? 3 o'clock?
I don't.
You guys need that? They're saying 3 o'clock.
15 minutes.
Yeah.
Okay.
Catherine always pushes for 15 minutes. I got it.
Okay.
Hey, how you doing?
Good.
So you didn't miss too much.
Only because the list I thought was the list.
She's gonna be in there. You got her bill.
Oh. She might have looked under the cushion.
Have a big food sale.
Start selling Aaron's candy.
Nice.
Are you, you're sitting on that? You're not sitting over, you're not making presentation?
Todd's,
Oh,
he's the go-to guy.
Has been appointed.
2-4,
That's what I was saying.
whatever.
District
And
five.
Steven doesn't want to do
Just
it.
created
Oh, yeah. You know what I just did?
Just- District 5.
She's the one that gets everything done.
Just like I do with Megan.
That's right, see?
All right.
All right.
I guess we'll do what you
She knows
know.
everything.
So, Todd, are you going to jump into the?
Sure, I'll jump in. Hey, good afternoon, everybody. Todd Watkins, and I'm the are they on? Hello? Are they on?
They are on.
All right, they're on. So I'm Todd Watkins, and I manage the county's road operations and maintenance division. And before we get started, happy Pi Day.
Absolutely.
Best day for an engineer.
3, 4.
That's right, 3.14, one of the best numbers out there. And
Too bad I wasn't born.
I know.
That's a sad commentary, Todd.
I know, I'm an engineer, so what can you say?
So
Right?
the pie thing got me thinking, yeah, I'm kind of hungry, so
Bring it on.
Oh,
Here's the pie.
3.1,
A la mode.
that's a bait and switch if I ever heard one.
that's true. So anyway, so we are here to talk with you today about the Urban Road Maintenance District. And Stephen Roberts is here today, but the star of the show is actually Sherry McFall. The artist formerly known as Sherry McFall, now Sherry Gray. So anyways, congratulations, by the way,
Thank
Sherry.
you.
So newlywed,
Ah.
Sherry. So she is Sherry Gray. So if you see Sherry Gray come across your computer screen, that is her.
It's not gonna be junk mail or.
No, it won't be junk. No, it won't be junk mail now. So anyway, so with that being said, I would, Sherry, take it away.
Thank you, Todd. Good afternoon, commissioners. We are here today to help prepare you to consider continuation of the Urban Road Maintenance District. Next slide, please. Oh, good. I can do it myself. If I can figure it out.
It's turned on. There's a slide switch.
I don't know, turn it on.
Is that the first, oh, there we go.
Okay. In addition to sharing the staff report and this presentation, we are also sharing with you an RNO for continuation and an IGA for road maintenance with Washington County LUT. The continuation is subject to regular sunset review every 10 years and will expire without an explicit order from you, the board, to continue it. The existing IGA was approved with 2 5-year terms. However, if you recall, we brought it before you in 2021 to ask for a shortened term, which you approved from 5 to 3 years. We did this so we could bring it back again now alongside the continuation and ask you to approve alignment of the IGA renewal term with the 10-year continuation term. It is our goal today to deepen your understanding of the earned continuation process if you need it. These are questions we hope you'll keep in mind throughout the presentation. We are, of course, happy to provide any additional information and answer any questions that you have. The Urban Road Maintenance District is a county service district formed under Oregon statute. Your board also serves as the URMD Board of Directors. Formation of the district was approved by voters in 1987, with voters approving funding in 1994. In that same year, 1994, the board approved the first 10-year continuation of URMD. Since then, your board has continued it twice more in 2003 and 2013. With each continuation, the findings on this slide shown are affirmed.
URMD looks a little different now than when it was formed. The population when it was formed was 133,000. The combined assessed value was 6.7 billion. And the levy was 36.5 cents per thousand. Today's levy is just under 25 cents per thousand. We've included the percentage of individuals in the URMD who identify as Black, Indigenous, or persons of color. This figure is 2% higher in URMD than in Washington County as a whole. The primary purpose of URMD is continued maintenance for roads and streets within the district, except for arterials and collectors. The primary tool we use to measure the effectiveness of road maintenance is the Pavement Condition Index, or PCI. The graph we see here tells the story of PCI in the URMD over the years. It begins with the first column and the first continuation in 1994 with an average PCI of 60. The story continues 10 years later with the second column and second continuation in 2003 and a dramatically improved PCI of 83. In 2013, with the third column and most recent continuation, the improvement continued with a PCI of 84.5. The story continues by showing each year's PCI since the 2013 continuation. You'll notice that in recent years, we've allowed the average PCI to dip to 80 and below. I'd like to ask Todd to explain the reason for that.
So several years ago, when the pedestrian and biking improvement program began, the Urban Road Maintenance District Advisory Committee, through collaboration and discussion with staff, determined that the PCI at about 80 was really higher than the district needed to be a serviceable target for the PCI. And with that, we modeled what a system would look like with a PCI of 75. And so since then, we've been slowly working our way towards reducing the PCI, the overall network PCI of 75, which is why you're now seeing that decline. A few slides later, you're going to see some good information that kind of shows what the effect of the pedestrian and biking improvement program has done to the PCI and how it interacts with the condition, overall condition of the road network.
Thank you.
I'm sorry to interrupt, but I've never heard you compare that PCI to the normal PCI we have on other facilities.
Oh, I'm sorry, what was that again?
Take all of our other road systems, other than the urban road maintenance. What's PCI in those areas?
Of the overall system?
Yeah.
It's
Extracting them.
It's in the high 70s, low 80s also, the overall network. Yes, we have a very good road condition system.
This PCI target that you just mentioned is consistent with the rural roads as well, correct?
The target value for the urban roads are different than, there is not a policy with respect to the PCI for the rural roads. This is only talking about the urban roads.
Okay.
Yeah.
Yeah, I just know we have this conversation in our rural roads committee.
Correct.
And it's in the 70s in there. I can't remember what that looks like, but anyway, it's consistent. So
correct.
Good.
Todd, will you
Oh,
guide us
and
through these slides as well,
Sure,
please?
sure. So we treat the roads in the urban road maintenance district two different ways. The first way that we treat the road is what's called a slurry seal, which is a thin layer of oil and sand that creates a surface seal, and it fills minor cracks and extends the condition of the road for several years. And it actually adds some of those PCI points that we talked about. That's what you see in the green column there, because we get a lot more miles done per year because we can do more roads with about the same amount of money as we can with the pavement overlays. The pavement overlay is the alternating service that we perform. And this is your traditional paving project where you have the hot asphalt and the rollers that come out, and you have a brand new road surface after that. When we pave a road using that technique, it resets the PCI to 100 for those roads. You will see a little blip there in 15-16 when we tried a different treatment, which was called a microsurface. That didn't work the way we wanted it to, or that we thought it would. It was an experimental technique that's used in other parts of the country with different climates. And so we ended up not pursuing that long term. So 1 year we do an overlay and 1 year we do a story seal. And right now, the annual amount is about $750,000 to $1 million per year, depending on what the specific network needs are. So we use what's called the 10-10-10 model. After a road's been in service for 10 years, we'll do a story seal. After another 10 years, another story seal. And then in the 30th year, or the 10th, the third 10, we'll do that overlay. And what you're seeing here is the blue graph illustrates that by doing 2 intermediate surface treatments in those early years, followed by an overlay in the 30th year, is cheaper than not doing any maintenance on the road at all, and then waiting to basically rear end load the costs at the final product, because it ends up being a reconstruction, not just a maintenance activity. So over time, by us doing these intermediate treatments, we actually save money and people actually get a better road surface the entire time versus living with a degraded road for a period of time. So it's a win-win.
Thank you. This is our road maintenance priority matrix, first adopted by your board in 1998 in the TSP, which I happen to have right here. This is the 1988 TSP, and the road maintenance matrix looks a little bit different, but it's right here. All of our county streets and roads that receive maintenance are captured in the 5 functional categories classifications shown. All URMD streets and roads that receive maintenance are captured in the bottom right corner. These are the lowest priority for road fund dollars. This means that without the district, these roads and streets would receive little to zero attention, except in the case of an emergency or mandated service. Without maintenance, these streets and roads would deteriorate unabated until they were rebuilt. A few slides back, we saw the improvement of the average PCI for URMD over the years. This graph takes that data to a more granular level. We can still see the average PCI at the top. However, each column dissects that year's average PCI into 5 descriptive categories. Red being very poor and dark green being very good. It's easy to see the makeup of this improvement in averages over time.
And I'll add to this slide, as I mentioned a few minutes ago, the pedestrian biking improvement program. In 2011 is when that program started. And you can see in 2012 that we had a substantial amount of our roads that were in a very good category. Fast forward 10 years, you can see that fewer roads are in the very good category. And then also, if you go down, you can see the poor and very poor are also inverted. Those changes in those different classifications of the condition are a direct result of the pedestrian biking improvement program. By diverting money from the road maintenance, still maintaining a really good system that still has a PCI that's well above what most people would consider good, you're able to then build the sidewalks and the pedestrian and the bicycle facilities, which we're going to talk about here in a few minutes. But that's a very descriptive illustration of where that money has gone from road surface to pedestrian and bicycles.
While still maintaining road surfaces well. The pedestrian and biking improvements program is a very popular one with URMD residents. Project recommendations are made by URMDAC the Urban Road Maintenance Advisory Committee. The selection process occurs biennially in odd-numbered years and includes staff guidance, public comment, and members getting out to communities and visiting the improvement proposal sites. I serve as liaison and facilitator for URMDAC, and it is my privilege. URMDAC members are conscientious and committed to recommending selections that are not only well received by residents, but are also cost effective. These are examples of pedestrian and biking improvements constructed in the URMD in recent years. The photos show pretty clearly how these improvements enhance pedestrian travel and accessibility. Residents of the URMD reach out often for traffic calming opportunities offered by the Neighborhood Streets program. Initially developed to serve neighborhood routes and urban locals, in 2020, your board approved expansion of eligible roads to include collectors with residential properties. Currently, there are 2 campaigns in progress for residential collectors, as well as several campaigns for smaller streets. We've discovered that our NSP model for neighborhood routes and urban locals does not support residential collectors in quite the same way. We are reviewing the process to identify adjustments that can be made to ensure that traffic calming is as accessible to residential collectors as it is to the smaller streets, such as neighborhood routes and urban locals. Development continues to add roads and streets to the district, and as cities annex, roads and streets are withdrawn from the district. As required by Senate Bill 122, Washington County has developed service agreements with the cities of Hillsborough and Tigard. These agreements identify the long-term service boundaries of the cities and provide for transfer of jurisdiction of county roads and streets upon annexation. They also specify that roads and streets must have an average PCI of 75 or higher before transfer, or the URMD will pay to improve them to that level. The county's road maintenance schedule and practices ensure that this minimum of 75 is met and sustained. On April 4th, your board is scheduled to set the public hearing for URMD continuation, scheduling that for April 18th. At the public hearing, your board will consider and hopefully adopt the RNO for continuation. The IGA is also scheduled to be considered on April 18th as a separate item. Staff's recommendation is to approve continuation of the district. Doing so will enable residents to maintain and in some cases improve livability in their urban unincorporated communities by ensuring that neighborhood streets will continue to receive cost-effective preventive maintenance, that pedestrian facilities and accessibility improvements can be constructed, and that traffic calming through the Neighborhood Streets program can continue. Do you have any questions for us?
Well, I was just looking at slide 5 because I was trying to get a vision of how big the URMD district is. I didn't realize it was that big. So would you go to slide 5, and is that what you're depicting there? Or is it the green area, or what is it? It's
The green area.
green area. Okay.
And keep in mind too, that if URMD were a city, it would be the second largest in the state, only behind Portland. So we serve a very large population.
The district is not that. The unincorporated area is.
Unincorporated, urban unincorporated. The district is urban unincorporated. And within those boundaries, the population of over 200,000 people would be second only to Portland by population.
Yeah, I guess I didn't realize all of that was in this district. Oh, okay. I thought it was primarily in District 2, but it's not.
Well,
You know, it's Metzger, Aloha, North Bethany.
Unincorporated.
It's Unincorporated.
It's almost all districts.
Yeah.
The heaviest concentrations are in District 1 and District 2, but it includes areas in all 4 districts.
I'd just like to, first of all, thank you for the presentation. And I sit on URMDAC, and I just want to give kudos to both of you for the work that goes on in that committee. It's well run. There's a lot of interesting dialogue, and I believe that the participants are really committed to what they're doing. And it's just this great window to see the community working with staff. I mean, I really enjoyed that. So thank you. And thank you for the work. And I'm certainly thumbs up about making sure we go for the next 10 years.
So just to make sure I understand that slide, it is 5.9 million. That's what you collect
In revenue.
annually.
That's correct. Yes.
Okay.
Catherine, do you want to go next? Do you want to go last? Last?
We can't hear you.
I finally found the answer to my question on our website, so I don't need to ask my question. Thank you.
Yeah, thank you, Vice Chair. I've taught your opening statements that Sherry was going to be the star of the show. You were right, spot on. Great job, Sherry. I have a small question. One is just the snow debacle that we went through. I am wondering if the services that you mentioned, the funds collected, are used to pay some of those services. Snow removal, does that include in there?
So snow removal is actually included in the ordinance, the original ordinance,
Okay.
when the district was first formed.
Mm-hmm.
Unfortunately, we just do not have the resources and the staffing and the equipment to hit every single county road, whether it be
In the unincorporated.
in the unincorporated, right? Yeah, so the neighborhood streets provide a unique challenge as well. Not only do our big dump trucks not play nicely with those urban streets, but also you have parked cars and you have mailboxes and you have garbage cans. It's a different environment than, let's say, a Murray Boulevard or a Shoals Ferry or 185th. Now, with that being said, we have gone into neighborhoods at times for specific reasons, or if there's a need for something, but it's not something that we have the capacity to do. Although it's an allowed service, it's part of the original ordinance. We just don't have the resources to be on every road. There's over 400 miles of road in the district, and that's just more than what we can handle.
Okay. I don't know, when do you think the county should have that conversation? Because it sounds like snow is going to be in our future, right? And
I'm certain.
some of those
I'm certain.
unincorporated roads are big roads where I think I was in a meeting with Stephen recently. We were talking about Farmington and a specific area that's like the county and just Farmington in general, I should say, and where 12,000 cars were going up, and seemed the law, but since future snow is in our future, I don't know, when do you think we should have that conversation about what's in the ordinance and building the capacity? I know 5 million is not enough, but
Right. So we actually had that conversation with URMDAC. This was several years ago. And it was actually after the last really big storm that we had in 08, 09. And there was a discussion about, should the district be funding snow removal? So it's been a topic before. At that time, the committee's advice was, no, that's something that we're not ready to go down that path yet. And we really haven't pursued it at the staff level, again, because we are at our max just to maintain the major system. And so that's where we focus on.
okay.
Yeah.
Could I ask my last question, Chair Harrington? Go ahead, go.
She's done, I think.
Mike, I'd like to speak up on this topic if I could.
Please, yeah.
So I really appreciated our staff social media during the snow event and bringing to our attention the ice control and snow plow routes map. I'm looking at it right now. I think we've got a really clear web page on this that talks about how there are 426 miles that are identified routes on the map, but that we're really challenged to service all these different routes. So this is no small task that Commissioner Fye, you're inquiring about, and is a whole separate topic that would need to be dealt with countywide. But you know, having lived in snow country before, I do not look forward to really pouring water in a hole for snow removal and cut other really vital county human services. So I think folks are just going to have to do some better adjusting to snowy conditions in our area. But if you want to take a look at that webpage, go right ahead. I think it's really great. Thank you.
We have, right, and we have explored and are continue to explore other options. We're never done when it comes to trying to find ways to handle the snow and ice. There's always new products, there's new tools. We've explored and continue to explore contracting to see if we can add resources, but there's challenges and pitfalls with every one of those that we find. So it's not a dead topic, but it's a topic that we just haven't been able. Yeah, it's it's cold.
It's a perennial topic.
It's perennial.
Cool.
I have a different question, and this is sort of more of an educational question for me. So I'm just checking my knowledge about this topic. The property owners within, I'm so glad you have that slide up. The property owners within that URMD boundary are the ones assessed
Correct.
for this special. Okay. And then is this tax is in addition to other property taxes?
It's an
No?
actual line item on their property tax bill. It
Okay.
actually shows up
Perfect.
as a line item.
Okay. Yeah. I think I remember. I live in Aloha,
on
so
yours.
it's on my tax, but I just, okay.
Yeah, so if you look on there, and I can't remember what it says, but it's very clear that
It's urban.
you can tell that it's road related. I don't remember what it's actually called.
I think it clearly,
Says
I think it
urban-
says
urban.
urban road maintenance.
Maintenance, yeah.
Yeah.
Okay. Okay. Yeah.
Julie, what, John, the only 2 points I'd make is I've always been curious. Just looking up as we were talking, the shared gas tax in Beaverton and Hillsborough, which is a little over 200,000. It's about $15 million. And if you take a look at your slide on the amount of revenue that this raises, it's 5.9 million. So one of the points that we've made in the past is that if this were all incorporated, it's about 10 million bucks being left on the table, somewhere right in that vicinity. My question though, I've always wondered why, if we're willing to do 70 plus on a lot of these roads, and annexation doesn't mean that you have to annex all the ground around the road. It just simply would annex the facility itself. Why there isn't a program for cities to pick off some of those adjacent streets or those things that are real close to them, because they will set their boundaries in the future by those kinds of actions. So have there been any sort of conversations and saying, gee, if you take this stretch of ground, I mean, not only will you get more gas tax revenue, but I mean, you're pretty good shape, 70 plus, a lot better than if it comes in from annexation some other way, and you'll have boundaries to deal with. Has there been any discussion?
Well, I am not personally involved with the annexation discussions. However, I do support it. So when a road is up for annexation, I certainly support that occur. I do know that there are times when that doesn't always happen. Stephen, I don't know if you can speak more about the annexation topic.
Yeah, we do have some urban service agreements with a couple of the jurisdictions, and that is a topic that's addressed in that is when annexations occur, what is the orderly transition of services from county to city? And we do have, and our cities have been very good partners with us as they annex areas. They typically are very good about accepting jurisdiction of the local roads in the district and or
That's when the
within that
land is annexed.
annexation
How about
area.
in front of that, Stephen? Good example. Beaverton in the past was very, very good about, and I suspect they still are today if given the opportunity, but they were always looking at taking and annexing thoroughfares. They would pick up these streets and saying, okay, you guys maintain them at a certain level, we'll pick them up and then we'll gradually infill around them. Did we get
Yeah,
away from that policy?
That might be a bigger policy question than we're certainly talking about right now,
I know,
but
I
I
just
do.
wondered if we did.
It occurs sometimes. I mean, and the board, I believe, has changed positions relative to consent or positioning around what we would call cherry stem annexations. Those have differed over time, and in a lot of cases, jurisdictions have annexed major roadways, but don't take over the roadway itself. In other words, there's still county roadways that we anticipate being county roadways for a long time as a part of that countywide system. So there's not a one size fits all answer, I think, but the topics are certainly things that we're aware of and have ongoing discussions with our partners about.
Yeah, well, thank you for that update. I've always thought that there should be some policy. If it's, to me, it doesn't make sense that somebody annex a ground in unless it's an arterial that we need to maintain into city to city. It doesn't make sense that they say, I don't want to take the road. I'll annex everything around it, but you guys have the road. To me, they should be accepting that road.
Yeah, no, that's a discussion that we have when annexations are occurring. And I think to the point in the presentation, we view providing a high level of service in these areas as one less disincentive for a city to annex. In other words, they're not annexing an area that has streets that are crumbling and or maybe missing sidewalks. So this district has been quite helpful in ensuring that we maintain those roadways in a good level that might make it more attractive for a city to be able to easily accept jurisdiction and responsibility for those roads going forward.
Just a policy question.
Yeah.
Yeah. All right. Anything else from anybody? I guess, are we all okay with, I mean, it's been a good program for a long time, so
And we're gonna leave the rate at the same and just gonna.
Just renewing it for another 10 years.
Okay.
So we'll be back on April 4th for you to set the public hearing, and then April 18th for the public hearing and to adopt.
great.
We're so inclined. Thank you.
Thank you.
Thanks, everyone.
All right, I guess we're at the end of the day and we're going to go into, how are we going to do this? Do you want to do the letters first? Do you want to do the updates first? Who cares? My choice, my choice.
Your choice.
Well, if it's my choice, then I pick on you. Sonia, you get to start the updates.
Oh, I get to start the update.
Yep, you get to update.
Well, good afternoon. We've had a long day already. So I did send your board an email just as a heads up. We are moving forward with solicitation of proposals for your board's goal or priority setting process. And I'm curious if your board would like to establish a subcommittee to work with Ms. Rachel Fuller and I through that process to ensure that the consultants meet your board expectations.
I will turn to the board.
I'm happy to give you my opinion.
Sure, go ahead.
No, I mean, in terms of, as they go and look at facilitators for that discussion, I'm more than happy to participate and give my opinion.
Is there anyone else?
I'd be happy to.
There you go.
Anybody else? Am I stepping on toes here?
I got plenty to eat.
Okay, so Ms. Fuller will coordinate with your staff assistants as we work through the process to get times and meetings scheduled. And that was actually my only update this week. We've been working on budget. So that is where my head is in budget numbers, thinking about FTE services 4, 7, 10. So I know I appreciate the board's understanding, especially this last week, as there may have been delays in responses to emails or meetings as we've been really focused on this work. I also want to just express a deep gratitude for every department for their really thoughtful work. I'll be excited to share the work that our team did, as difficult as this is. Our employees really care about our community and the services that we deliver and that impact. We've evolved our budget equity tool and really seeing another year of evolution in implementing equity-based practices and service delivery. So as challenging as this budget will be, it's also a reminder that we are delivering amazing services to our community, and we have amazing employees that are the conduit to that service delivery. And that concludes my update.
Great. Tom, you're up.
I wanted to give you a brief update on the aid and assist litigation, which you know is going on in federal court. Months ago, we had asked Judge Mossman to order a mediation among the parties to see if we could get a solution that all the stakeholders could participate in. Judge Mossman issued that order last week, and there's a session scheduled for Thursday, an all-day mediation session. In preparing a letter, I reviewed the Dr. Pinnell's, who's the outside expert's fourth report, and it's interesting. It covers the period between September 1st, when Judge Mossman issued his order, which you'll recall sets strict standards for releasing patients from the state hospital without regard to what their clinical needs are. After issuing that order, we have not really seen a reduction in the wait times. In fact, we've seen an increase in the wait times, and that's probably driven by an increase in the number of aid and assist requests. And it's my own personal belief that this is probably when a change in the incentives of a defendant who is looking at a long potential prison claim, who knows that they would only have to spend at max a year in jail for a Measure 11 felony, or 90 days for another felony, might be incentivized to not aid and assist in their own defense. So I don't know if that's true. There's no hard data, but we have seen an increase from about 70 or so a month in January to over 95 in the months of November and December. So the fact is the order is not doing what it intended. We went from 15 days waits to 20 days waits now, the average in December. So we're going to discuss all of this on Thursday. The plaintiff's letter suggests that we double down and have even stricter time limits and get more people out of the hospital. The DAs, the hospital, the counties are all working together, and the courts are all working together to try to find a more reasonable solution to this really difficult problem. As you know, also there's a bill in the legislature that was intended to codify the limits in Judge Mossman's order. And Brad Anderson went down and testified on that last week. And hopefully that will not go anywhere. And they're looking for other solutions, such as funding more community-based treatment beds, which is one of the answers, and also providing better funding for the state hospital. One of the things we've heard anecdotally from the other hospitals is that there are many empty beds in the state hospital, which they can't fill because of staffing shortages. So one of the other proposals before the state legislature is to increase the pay for clinicians at the state hospital so they can address some of the staffing shortage issues. It's a complicated problem. People are coming at it from very many issues, and I'll report back what happens in the mediation this Thursday. I'll be there all day. That's my report.
Yeah, that's easy. Hi, Diane. Welcome today. You want to give your report?
Thank you. Good afternoon, Clean Water Services. So I only have one announcement today, and it's to let the board know that the president's budget did include $7 million for Scoggins safety of dams to do the environmental impact report that they need to do. So it's in the Bureau of Reclamation's budget. So that's a great news that the project is moving along. The new estimate now is $900 million, and we anticipate that will probably change and increase by the time they get to final construction. But so that project is moving along with funding. So thank you.
Great, thank you.
Can I go back to Tom for a second?
Oh, do you have a question, Tom?
Yeah, just, well, probably more of a comment, but it doesn't surprise me a bit that those numbers are going up because those folks who are currently in jail have plenty of time to study and research, and so they can figure these things out pretty quickly. But I did think, for some reason, I thought that those that were convicted, not convicted, charged with a felony, didn't fall underneath these guidelines. So
No, so it's 60 days for misdemeanor, 90 days or 90 days for a felony, and a year for a Measure 11 felony.
wow, that's a real deterrent, isn't it?
Well, I mean, yeah, it's a challenge. And the real answer is that we need more beds. We have seriously mentally ill individuals who need both hospital care and community care. And the state's actually reduced the capacity of the state hospitals since 2005 from 850 to 705. But we've heard that they're only filling 500 beds. So, and there's only about 100 people on the wait list. So you could take care of the wait list by just filling the beds that they have. It's a very challenging problem, and lots of people are working on it. And one of the other things I should say is the deadline to release all the people who were in the hospital as of September 1st, who had passed those deadlines, was March 15th. The state and the plaintiffs petitioned the judge last week to extend that for 5 individuals accused of Measure 11 felonies who were due to be released by March 15th. Now they won't be released until May 15th because they're trying to find placements for them. We know at least one of those individuals is came out of Washington County.
Comforting? Yeah. Jared, do you want to go next or do you want to go last?
Well, I think, why don't I just take care of one thing that is for the board, and then I'm happy to go last with my other report outs. Just for a complete board item, I shared an email last week subsequent to our work session of Tuesday, I think it was March 8th, on the climate planning update topic that we had, because there was some concern from various board members shared with me about how that came all to a closure. And so Ms. Angie, I wanted to respect the fact that you and your staff were very busy with your budget work. So I just tried to summarize what I heard from the board members both that day and the next. So I would just like to confirm it here with the board and catch up with Ms. Angie. So I'm currently not looking at the video screen, but let me go back. Are you guys okay if I do that right now?
Sure.
Okay. So expressed through the board was a lot of appreciation for the approach that was taken, and that there was comfort with the moving forward with the option of the Climate Adaptation Plus option that was enumerated and the general planning timeline. Also, that the board was really pleased and appreciated the good work that went into putting the proposal together. But I heard both at the work session and subsequent conversations that we have 3 points for clarification in the climate planning timeline, there were multiple phrases that there were multiple phases, excuse me, phases, not phrases, that were enumerated in that timeline. And I certainly myself didn't notice that underneath phase 1, phase 2, phase 3, there were these terms around needs assessments, prioritization, strategy development, and plan development. So we just need staff to circle back with us and give us some further enumeration of what the intention is behind each of those phases. Then in that progression, we could see, and it was referred to with advisory committees referenced, but we don't have clarity in terms of how the board is on that planning journey. And we've tried to avoid the board only being involved with or engaged at the beginning and then at the end, and total darkness in between. So we're trying to get clarity on that. And then lastly, we appreciated hearing how the Public Health Advisory Committee and ACRE would be utilized. But we asked the question, what about all those interested parties out in our community? Because multiple commissioners thought that we had said in our prior direction, we wanted a process to enroll them as well, and we just don't see that. So I had said that I would raise this at the work session, and I don't know if Ms. Angie and her staff need more time to look at this and get back to us, or what.
So that was my understanding, and thank you, board. I did not prepare anything for today or a presentation. Those questions we would be following up in a subsequent presentation that would be scheduled with the board to go one step further into that timeline and to answer all the questions you had outlined previous, Chair. I won't repeat them. The other question I do want to indicate that I have heard is further clarification within that planning process of mitigation and adaptation. So clearly defining the terms and understanding how both of those aspects fit in to that planning process. So that's something that I've also heard as a request to come back for clarification.
Does that seem reasonable?
Yeah, I'm fine with that. Obviously, I sent out to the to everybody on the board today the technical definition of those terms, and in some regards it helped me understand it. In some regards it made it more difficult because it's technology jargon for that topic. So yeah, I'll wait till you come back on this. I think one of the things that I've been told, and I'd like confirmation of, is that we're going to need a resolution to go for any grant money. So I'm not a big fan of resolutions, but I would like us to maybe consider that we, I guess, revisit that conversation for what a resolution would look like. I have not looked at the one that was proposed, so I'm not going to weigh in on that. But if somebody could confirm that we absolutely need to have a resolution before we can go after any grant monies, I think that's going to be important because there's grant money available.
And particularly, are you thinking about the grant money available through for example, the EPA, so through the feds?
Yes. Yeah.
Yeah, I'm following you on that. Yep.
Or any, if there's a requirement, right? I mean, I would just like to know.
Yeah, the one thing that I heard is
I'm not aware of any state. That's why I was asking.
Thank you.
Yeah, I think the one thing that, I told you, I heard that ODOT presentation last week at Northwest Act, that they were talking about a renewable diesel conversion grant money. Well, I went to Robin as she was walking out the door and she said, no, we've already done that. So, okay, we've already converted to renewable diesel. So I didn't know that. I guess it's those kinds of programs though that I don't want us to miss out on. Looking forward and just taking small bites at this apple. And if that means we have to have a resolution, then let's talk about that.
Thanks. I just was reading what you sent. That was nice. Thank you.
Yeah, those definitions were provided to us in the packet last week as one of the handouts for the topic.
So it's my understanding that, Tanya, you're going to come back with more information. Is that correct? Is that where we're headed right now?
The information that the chair had included in her email to the board and that had just spoke to verbally, that was my understanding. And I also have heard from individual commissioner, how does further within that planning scope, how does mitigation and adaptation fit into that? Parallel to this, we are currently working with our metro regional partners on exploring the option to pursue an EPA planning grant. That may need a resolution. It is too early in that process of convening staff on what will we need. They have held one meeting and I'll hopefully be able to report out more detail in the next coming weeks to your board.
Yeah. Yeah.
Oh, I'm sorry. No, I don't have anything to say. Go ahead.
Oh, I'm glad you're coming back to us and sort of loop back on this conversation. I try to rewatch the session from March 7th, work session on climate planning. And in the email the chair sent, there's a bullet point that says the board is comfortable with the proposed. Having been on that work session in person and then rewatching, there was no question asked to the board. There was no direction that was provided in terms of, are you comfortable with this proposed? I think my understanding is public health modernization work that is moving forward, that is in their work plan. Not now, from previous. So I'm not sure that bullet point is correct. My understanding from the takeaway. So I just want to emphasize that that wasn't what was asked. So I think I appreciate you coming back to us. We need more clarity on this topic and just to flesh it back. Just to have the broader conversation.
Okay.
So I do want to just indicate for that presentation and coming back, I will be the one who makes the presentation versus staff, because staff have come back multiple times to your board on this item.
You'll do well.
Jerry, do you want to give your report out?
Sure. Start the clock there, Kevin.
He's got it.
So
The 1 minute warning.
Huh?
1 minute warning for you.
1 minute warning. Okay.
No.
So the chair and Nafisa, you were at the Hops.
Yes.
Yeah. They had a great press conference last week announcing, of course, you've seen in the paper their focus on building a new stadium. And there's lots of information about it, but it's pretty exciting news. And Rich Burke, who's the announcer for the Hops, was sure and clear in his media presentation that those in Portland need to understand that there is a professional baseball team in the region and it's in Hillsborough. So he kind of took that little shot at him. I thought it was pretty funny. Met with the government affairs team at TriMet. Pam and I, not together, but I think you met with him after me. And so it was good to meet him. He's only been with TriMet for a little while. And so he was just kind of introducing himself. GPI consultants. GPI has hired a consulting firm to work on improving the image of Portland and the region. And so we talked about the challenges that will certainly bring. Went on Colpack and Northwest Act. That was my junket on Thursday. I was supposed to do that in Astoria. I, at the last minute, decided that was not a very good idea for me to drive to Astoria and back, considering I had like 3 meetings after I got back. So I don't think I'd have made those meetings had I actually made that junket. But anyway, we had good conversation and reminding that we are starting the recruiting of a new executive director for Colpack. Northwest Act, of course, we reviewed the vision statement and had more conversations about carbon reduction programs. That was the one I told you about from ODOT. TV Highway Steering Committee was also on that Thursday. That was one where I didn't get to listen in very long on that. I was taking that as I was en route to my next meeting. And so I didn't get to finish that one up, but of course we heard that update today. And so that was good information. West Side Pitch competition. West Side Pitch is for promoting startup entrepreneurial businesses. These were really impressive. That was the finishing up on my Thursday night. Handed out a check to the finalist, number 1 finisher for $7,500. The rest of them, there was 6 of them that made it into the finals. It was really impressive what these people do and the research they go through to get their businesses started. Attended the AOC Transportation and Community Development Committee. We talked about a number of bills that are in process, and so took a position on those, and we forward those on to the Legislative Committee, which Pam and Catherine will participate in. Met with Sherwood Mayor Rosner and just had a conversation. He is on the Broadband Advisory Committee, and that was the primary purpose of that conversation. And just to find out where the state is going on this and Business Oregon. So it's a real chain of command there, down into the broadband, and then of course dropping down into the regions. And so we're very interested in what they are doing and how we can find the money, right, Catherine? So
yeah, I'd love to know that.
huh?
Yeah, I would love to know that.
Yeah, well, making sure we're in line when the checks are handed out. Swearing in ceremony. Yesterday was Commissioner Fye and Tanya and I went to the swearing in ceremony. That's always really, to me, a really important ceremony. And I've asked the sheriff if we could in the future, as a representative from the commission, have a couple of minutes right at the front just to tell them how much we appreciate their service and to make sure that they know that we're not just there just for purposes, but we're there to encourage them and say thank you to them. Also, real quickly, I start my quarterly series of meeting with every city in my district and their city councils at city council meetings. So I start that tomorrow night at Gaston and then over the next few weeks. And then I've also decided Thursday morning to attend NAOP, which is generally, Portland business group, but they are having a panel discussion with the Portland and Multnomah County officials. So I'm anxious to hear what they have to say about how they're going to, what decisions they're going to be making and how they can kind of change the direction of the city of Portland. So that's where I'm going Thursday. So I'm done. Over my time too, sorry.
Not by much. Let's see, I'm going to start with, I had a coffee this week with Duncan Wang, Metro Councilor, an introductory meeting, but I also met with him in regard to his role at Apano. My population in District 2 really means that I need to be more focused on Apano and understand what their goals are in relationship to Washington County. So I'm building that relationship. I'm also connecting Doug to Comey Calabar to talk about Apano's work on housing. He wanted that introduction. I also met with John Sarah from TriMet. The MPAC Coordinating Committee meeting was last week, and the upcoming agenda for next week's meeting is really an update type of meeting. There's an update on SHS and the affordable housing bond. There is an update on the development outcomes in the past UGB expansion areas and urban centers. And there is going to be information on the Expo Futures update. So that's what's happening at Impact. But also, I'm also holding the first phone conversation prior to Impact meeting with our Washington County people that are there. I attended the White House meeting on CHIPS and Science Act along with the chair. I'll let her go into detail here, but I think what I want to do is just say it was really good to have the chair speak up and talk about what the issues are in relationship to Washington County and to focus on to make sure that the focus was included housing and how housing is important. Most of the other topic areas were covered. It also was nice that she could say that she worked for Intel, so that there was definitely some street cred that came along with that. So that was good. We had the PAP meeting on last week, and it was really discussing the ESG proposal rating results and voting to approve those. Yesterday, we had the AOC meetings. The legislative meeting featured quite a bit of discussion on water policy and rural ADUs as vacation homes. There was the public safety slate and the transportation and community development slate passed with no questions. The board of directors also met to review Executive Director Nichols' performance. So it was a lively meeting, but not as lively as others have been in the legislative committee, actually. I think, and again, the chair was there. She can add any color to that she might like. I also attended the AOC reception. It was an open house to celebrate their new building. It was a nice reception. The food was really good. And then went to the Beaverton State of the City last night at the Research Center. This week I have an URMD meeting, Home Share of Oregon meeting, with Tess Fields regarding HB 3032, a homeless plan advisory committee meeting, Brett Morgan with Thousand Friends meeting on ordinance 882, and the RDPO policy committee meeting on Friday. So that's it.
Okay, I'll go next. Yes, I think the event about the hops, that was a really great press turnout.
It was.
Didn't know what to expect. I know it was snowing, raining, and then the state of the city for Beaverton, that was a one well put together event, and really appreciated being among community members and then hearing the mayor's plan and all the work that the city of Beaverton and the mayor's been doing. Two things that we, as your board representative, that I took action on that I just wanted to bubble up. One is AOC. We had to vote on the Public Health Modernization General Funds for community-based organizations. This has been a many months conversation that our staff as subject matter experts and our lobbyists have been involved in. It was actually a plan or agreement that everyone was comfortable, that everyone felt they can live with. So everyone, including myself, voted in favor of supporting. And then one county commissioner opposed, and the reason that they opposed was the agreement that CLO is making with Oregon Health Authority. They felt like it didn't go far enough. And they were a rural county representative, county commissioner. So that was that. And I really appreciated the chair and I had a check-in and we reviewed the policies that were on the agenda. So that was really helpful, Chair, that when the conversation about these bills came up, it was easy to go along and ask questions if there was any question, but and I appreciate our staff, government relations are really organized, and they have this document that has the implications of all these policies that they're tracking and the committees that they come about. So thank you for that wonderful document. In terms of transportation, I won't highlight TV Highway. I think we've had a great presentation today. There were 2 action taken at WCCC yesterday. One was the members approved to amend the TDT, the Transportation Development Tax project list. And then just to highlight that list will come to us for our board approval in the upcoming meetings. And then the other approval that WCCC made was the members approved $107,000 from the MISTIP Opportunity Fund as a match for 3 metro regional travel options grant applications. So that was 2 significant things that happened. Other than that, I'll donate my 1 minute and 49.
May I have a second?
Yes, absolutely.
I forgot to mention the AOC dues committee meeting this morning, and it was a good meeting. Chair, I'll defer to you. I had to leave a little bit early. I assume that we're going to be meeting again, but the best news is that I think that AOC is really aware of what the issues are, and they're certainly listening, and that's a different position that I felt about 6 months ago.
Good. I'll take your last 1.19.
Seconds.
Yeah.
Yeah, absolutely.
That's about all I'll need.
You get 6 minutes and a half.
No, I don't even need that. Yeah, I met about 3 weeks ago with John Sarah. I think he's a nice addition in Tom Markgraf. I had some time with them. Upcoming, other than working lots and lots of hours, I have a joint committee meeting tomorrow with WEA. I guess their government relations and land use and housing committees are all meeting. That means something to you, Pam. They're having one big joint meeting. I'm also having a meeting on the R1 Act agenda. I can't tell you what that is because they didn't have one before. So they're following up with a real agenda once I don't know that. They have a BAC meeting that's the Tualatin Chamber. They've invited me graciously, as they continue to do, to hear their concerns. Heard during our meeting today from Tim Rossner. He has a different issue, and I always like Tim. He and I have a great relationship. And then the council president of Tigard, you might said, yeah, he wrote to say, thank you all for Wood Springs. That's great, Roy. And wanted to set up an appointment with me for sometime in the future. Talk with Kevin O'Malley, who I may not be a name you all know, but Kevin and I go back about 25 years. He's the chamber manager in the city of Wilsonville. And that's about it. So I will give my 3 minutes and 40. No, I don't do that because that'd be 8 minutes for our chair. That would be a long. New clock.
Well, hopefully I won't take that much time. Last week, we had another one of the Supportive Housing Services Tri-County Planning Body meeting. And sometimes I feel like we continue to plow and replow the same ground, but still working to finalize 5 different goal areas and specific recommendations and come to agreement on that as a group so that the 3 region staff and metro staff can complete the work for those recommendations. The 5 areas are coordinated entry, regional landlord recruitment, healthcare alignment, training and technical assistance, and then lastly, employee recruitment and retention. I hope to report that at the next meeting that we will have completed all of that work and then provided it to the oversight committee, the SHS oversight committee for validation, and then on to the Metro Council for good understanding. SEPA and a couple of other community partners held a housing forum on homelessness one evening last week. It was very well done. I'm glad that I went. They had a really good crowd. It was held at the Broadway Rose Theater in Tigard. A lot of great acknowledgement of the partnerships and the progress as a result of that program. Commissioner Treese mentioned the White House Chips and Science Act meeting. It was really an effort on behalf of the White House to their meeting with cities and counties and perhaps with state legislators as well, to make sure that we know that the act has provided a lot of information about what the different proposals need to include, proposals from private companies as well as from states. So I think we're on top of that. So we'll see what happens there. Really, for us, the ball is in the state's court at this juncture. Also last week, a opportunity came up to be interviewed by Eric Schmidt for the County Talk program on TVC TV. So I seized that, around the budget circumstance. So I volunteered to play that role. It was okay. The straightforward questions turned into multi-part paragraph questions. And so I'm not satisfied with my own performance. I'll just leave it at that. Commissioner Treese mentioned our work yesterday at AOC Day. I was here all day yesterday because the Public Safety Coordinating Council and the Governance and Revenue Committees had their round at the face-to-face meeting. So I came down for that 8 o'clock meeting and just stayed on through the ledge and board meetings and came down again today so that one of the two of us was face to face for the Budget and Finance Committee meetings. There have been a couple of follow-up conversations, not only the tail end of that, but also here in the AOC building today. And I think Commissioner Treese was right to highlight the promise, the hopefulness of some adjustments. I think a lot of folks have learned how the construct provided for an improved base level of funding, but there are certain consequences for how using that year over year is problematic. So some good work will be happening. And it was great to see folks at the State of the City of Beaverton event last night. My last thing is to ensure that everyone knows that I'll be out for a couple of weeks starting on Friday. My mother's husband of over 40 years, he's 101 and a half years old. He's in hospice care and actively going through the dying process. So I will be flying to New Hampshire to help her for a couple of weeks. It's the first of 2 trips that I know I'll need to make in order to get her moved to a better learning circumstance. I was planning to take the week of March 27th, that school spring break week, off anyway from work as it is. So I'll just be adding a week before that. I will be participating in our meetings next week, and I'll endeavor to keep up better than I did today with incoming information. But if nothing else, I'll just sit there and listen so that I'll have the value of that. But I want to thank Vice Chair Rogers in advance for handling both of those meetings next week. And there are a couple of other meetings that I will continue to have next week, unless, of course, things go sideways, which they may well. So thank you all for your consideration. And hopefully we will have more spring sunny weather by the time I get back.
Yeah, great.
Thank you.
Thank you. We have, I guess, as a last action, there's 4 letters, as you know. I think you've all seen them. One City of Banks on the Salmonberry Trail. Another one is from City of North Plains, library expansion. Another one is from Hillsborough for their transit center expansion. Another one is from TriMet. It's really the Tom Bryan, you know who that is, and that's the Tiger Transit Center. It's right downtown Tigard, and needed a little bit of tender loving care. So those are the four. And we're being asked if we can have our chair sign those and move them on. So are there any comments, questions, issues?
Good.
I'm all,
I'm good.
that's 5 of us are all saying yes. So I guess that was a fairly quick item. Anything else to come to the good of the order today?
I do want to say that I'll be gone for that week of spring break as well. A plan change in my part, so.
Oh, hopefully fun.
We don't have a board meeting that week anyway, though.
No.
We already canceled
Nope.
that, so yeah.
Are you asking because you want to declare an emergency board meeting that way?
Yeah.
Yeah, no, please no. All right, anything else? Nothing, then we're adjourned.
Sounds good. Thank you.
Drive safely, Catherine.
Mhm.